motion to approve the chamber report for recording purposes?
Motion to approve. Second.
We have a motion, second. Any other discussion? Other discussion, all in favor say aye. Aye. Opposed? Pass.
All right, we can go back up to item F, budget amendments. F1's regarding the FY22 budget. Francis?
FY22 budget amendments, starting with F1A.
Is there a motion to approve F1D through F1I?
So moved. Second.
We have a motion, second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
Under item G, bids, RFPs, RFQs. G1 is authorization of recommendations. G1A regarding bid 22-004, aggregate surface treatment for delivery and pickup.
All right, what's the pleasure on items G1A?
Motion to approve the purchasing director's recommendations on the bids.
Second. We have a motion, second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
All right, item G1B regarding bid 22-005, asphalt emulsions for delivery and pickup.
Not what's the pleasure, of court?
Move to approve the recommendation of the purchasing director.
All right. Is there a second?
Second.
All right. We have a motion, second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Pass. I'd like to go to item L1. We have Shane Turner and Fiona Bond here. This is regarding the U.S. Department of Treasury Coronavirus Local Fiscal Recovery Fund American Rescue Plan Act, discussion or action regarding the eligible expenses and our funding guidelines, reporting requirements, and funding request.
So I'm Fiona Bond, Executive Director of Creative Waco, and of course this is Shane Turner, owner and operator of the Hippodrome.
All right, so we will recess until 1 o'clock tomorrow. So it's 11. All right, good morning. Let's call court to order. Today is Tuesday, March 1st, 2022. It's 9 a.m. Proof of posting, please.
The agenda was posted on Friday, February 25th, 2022 at 3:10 p.m.
Thank you. And if anyone has a public comment, they can come forward now from the audience. Yes, sir.
My name is Shannon Caraway. I'm Vice President for Business Development for a company called Solar Prime. Currently, we're trying to develop another 300 megawatt solar farm and 300 megawatt battery energy storage project here in McLennan County. And it's out north of Trading House Creek Reservoir, that area there. We're preparing to submit a proposal to this body soon for a county tax abatement for the project, and just wanted to stop by ahead of time, introduce ourselves, and tell you what we're doing.
Going to D on proclamations, resolutions. We have nothing this week. Under E, under consent agenda, I have no recommended pulls. Does anyone else have a pull from the consent agenda they want to discuss? Seeing none, is there a motion to approve the consent agenda?
So moved. Second.
Motion second. Any other discussion? Other discussion, all in favor say aye.
Aye.
Opposed? Pass. All right. All right, good morning, everyone. Let's call court to order. Today is Tuesday, July the 11th, 2023, 9 a.m. Proof of posting, please.
The agenda was posted on Friday, July 7, 2023 at 8:40 a.m.
Thank you. All right, at this time, let's stand briefly for a moment of silence, and then we'll have a pledge to the flags.
Please join in the pledge. Pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The Texas pledge. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one indivisible.
Thank you. All right. If any members of the public want to speak to the court on business matters, please do so at this time. Seeing none, we will go to items. I'd like to go down to item E1, additional items and discussions, potential action. So Dustin, if you'll go over that.
Yes, sir. So item E1 is a discussion, consideration, and appropriate action regarding settlement terms with Walgreens, CVS, and Walmart defendants, and authorizing the county judge or other authorized officials to execute the settlement participation and release forms regarding statewide settlement offers in the matter of Texas statewide opioid multi-district litigation for the county, in the matter of National Prescription Opioid litigation. So this is similar to the Allergan settlement we had back in May. It's just really the next step. It's a statewide settlement with the litigating counties between the state, Walgreens, CVS, and the Walmart defendants. This one has a very short timeline as well and must be back in by August the 4th to coincide with those national settlements and also with the Texas settlement. So if there's any questions, Herb said he could be available and via Zoom to jump into an executive session. But as mentioned, it is very similar to the Allergan one and really just the next step in the process.
Right. As it says, it authorizes me to sign the documents, been reviewed by legal and worked on by lots of folks. Any questions or comments? Now, what's the pleasure of the court?
Motion to approve.
Second.
Motion been made and second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Pass. All right, going to items D1 regarding the FY24 budget. So I'll turn it over to Francis.
Good
Morning,
morning.
Francis. Morning.
So we've passed out a revised schedule for this week as well as the last week of July, just to give you an idea of the things we have scheduled. Of course, it's ever-changing every day, but just to give you an idea of what's going to be covered. Before we get into our regular scheduled agenda for today, Judge Coley is with us, and there's a request that Anna's going to be speaking on later this morning, but he had some time today. It's a request that we would like him to speak on and give
Okay.
his reasoning.
Great.
So, Judge Coley? And just to give you a little information, it's a request to create a full-time position, a court admin assistant. This would replace the part-time funding that is in his office currently.
All right. Thank you all for creating a little bit of time early for me.
Yes, sir.
Currently have a part-time assistant court administrator. I want to convert that to a full-time assistant court administrator position. And I think y'all may or may not know, on July 1, I took over as local administrative district judge.
Congratulations.
Well, okay, well, I guess we'll hold off on that. There do come, with that, there are a lot of administrative tasks that have to be accomplished. I've designated this person to sort of lead those things administratively amongst all the staffs. And I'm trying to create a system that's going to be coordinated. There are a lot of tasks that come with that. And I really do need that additional time that she can put into those things. And so I'm asking to convert that I'm happy to answer any questions about the administrative district judge position, what it can do. I've done this now for, I guess, 10 days, so I don't have a whole lot of information to give you, but I know there's a lot of coordination that needs to be done to make sure it's done effectively, so.
All right, any questions on the position?
And for whom did you take over?
Judge Menard.
Judge
That's what I was
Menard.
thinking, okay.
And, I do want to recognize Judge Menard for serving in that capacity. It's just taking on additional burden on top of what they're already doing, but, she did a good job, communicated well, and really glad Judge Coley's got, I don't know if he had an interest, but he's got the job, and I appreciate him doing it, and we look forward to working with you in any way that we can. Any questions on that position? Now, he and I visited a little bit, it appears it's definitely needed, and I would support it. And I would make a motion to add that position.
I think we just do consensus on this right now, right?
Oh, that's right, yeah.
And so
I'm
when we
sorry.
come back
You're
to
right.
the full
Thank you.
listing later this morning.
Thank you. And Anna, did you have anything to add to that? I'm sorry, I kind of jumped.
No, just that his court is the only court that has one full-time position. All the other courts do have two, or at least two full-time positions, including the newest court. They have the juvenile administrator and then a court administrator. So it wouldn't be,
So I guess the best way instead of a motion is, thank you for bringing that up, but anyone see any issues with it?
I just want to know how Judge
Consensus.
Menard persuaded you to do this. That's-
Well, it's helpful to have multiple people that have done this in the courthouse. In the past, the LADJ has retired and then left, and it's been difficult for the next person, so thankfully she's still around and can help out. So.
Yeah, good. All right.
Sounds good.
All right, if y'all have any questions, though, don't hesitate to reach out. Thank y'all so much for taking me out of order. Thanks. Good day.
So today, we're gonna come back to our summary page here later, just depending on how long everything takes. But when we left Thursday, we had made a few minor changes, but there were those below the line items that we call them the discretionary lines. And so those being all the personnel requests, any changes, new positions, if you decide to give a COLA, if you make changes to the health plan, incentive pay, just all of those items that relate to personnel. So Anna is going to cover all of those today. And so we're just starting.
thank you, Francis. I hope we can cover all of it today. It seems like a lot.
And can I make a statement right quick? I think this week, we're posted through the whole day today, half a day tomorrow. Thursday, we're not meeting due to some conflicts that several commissioners have. And then Friday, we can meet Friday. And I would encourage us to try to get through as much of this as we can, because the following week, the North and East Conference is happening, and then after that, not all the court will be here the whole week, and some may be able to Zoom in, so it'd be good if we can get as much done as we can, but don't want to leave any questions unasked and answers not given, so just saying that to know that we're gonna step on the gas when we can.
Yes, and my goal is that by the time we all leave here Friday, that you will have heard everything and that we have some idea of what you're wanting. The only thing then, there'll be a lot of cleanup items and things that you have questions about we may come back to, but that last week of July, the first 2 days will be heavy on outside entity presentations.
Right.
So we have those kind of after the fact, so that the county's operating needs first, and then we'll look at those other entities.
Right.
Yes, sir.
So there's no item that we can't come back to, because as Commissioner Perry pointed out, we hadn't approved this yet, so we can always come back if you see something later on. Okay? Thank you.
Can I share my screen so we can all see this presentation? So HR in the past kind of compiles a review of all of our components of our compensation package, and so we've done that again this year. And I've broken up our review and analysis in two parts. And the first part that we'll cover this morning is organization-wide programs that'll affect most, if not all, employees. I'd like to tackle those big programs first with the court. And then after that, the second portion of the presentation will cover that nitty-gritty stuff, the actual individual department request and position requests. There will be a few areas where it'll be easier to kind of jump to either the auditor's office kind of spreadsheets with numbers so they can go calculating as the court has questions. And then we'll also have Randy McGraw speak to the health plan component of our compensation package, as we know there's options up in the air that the court would like to discuss. So we'll jump into the organization-wide programs. And so I want to start first with a review of last year's actions and where we are now with our state of staffing. So last year we faced a lot of challenges, workforce-related challenges. So we had a 5-year high turnover at 22% employer-wide, and then we also had a 5-year low in applications we received for employment. So we were having people leave us and struggling to replace those roles. And we also saw a loss in our competitiveness as it relates to salaries. We were at a 0.95 external comp ratio. So when we compare our salaries to external benchmarks, we were below a 1, which means we're in line with benchmarks. We were at a 0.95. And the court was facing what looked like to be an 8.15% cost of living adjustment projection based off CPI information from the Bureau of Labor Statistics. And the court responded. And so last year, we overhauled the paid leave program to make it more flexible through PTO. A 9% COLA was issued, and a 10% COLA for detention positions was assessed. So that's for our juvenile detention officers and our jailers. There was also, it's not in here, but there was also a tweak to the step plan for jailers, making the first step more accessible more immediately at 2-year rather than 3 years of service. Also in an effort to try to tackle these workforce challenges. And there was no increase to the employee premiums as well, so they didn't face that budget constraint. So all that brings us here to our current state of staffing. We are seeing a drop in our annual turnover rate based off employment activity year to date. So last year, coming off of that 22% high, we are at now looking to end our year here at 18% if things continue to go as they are so far through May. We're also starting to see a turnaround with our employment applications received. Not a complete turnaround, we're just now not dropping, which is great. We're seeing a little glimmer of hope there with our applications, and we're still thinking of efforts for marketing our career portal. So I want to give that context for the court of where we are before we get into discussions of how to move forward for fiscal year 24. I think we're making good progress based off or because of actions for the current fiscal year. This year now, what we're looking at, I'm going to start getting into the status of where our competitiveness is with our salaries this year. And a quick overview, this is HR's method for assessing our salaries and where they stand compared to other entities and compared internally to ourselves. And so HR reviews positions and where they lie compared to midpoint, compared to market, compared to our county counterparts, which we have listed here on this slide 5. We have, each of the counties listed that we compare ourselves to. We ask them every year for their budget books or salary schedules so we can pretty much break it apart and compare it to our positions and try to match them up with our positions. So that's what we do every year. We have our pay grade that we compare to, positions within the same pay grade, and then our internal benchmark, which is positions of the same title that may not be in the same pay grade or positions of a similar function. A quick overview of our ratio, and that's how we measure against the benchmark. 0.8 to 1.2 is the range that we're looking for, a ratio for each of these benchmarks. What I've done in the next slide is summarize our external ratio and done a countywide average. And we're seeing major improvement to where we were last year following that large COLA. Our salaries countywide are now much more competitive. So we can see here on the right, in 2022, only 37% of our positions were at or above a 1 ratio when compared to external salaries. So when I say external, I'm counting our county counterparts and our market information that we pull from the Texas Workforce's labor market information. This year, we're standing at 78% of our positions at or above a comp ratio of 1, which is a great improvement. And then our comp ratio average for all of our positions combined, we went from a 0.95 to a 1.08. I add at the end of what seems like very positive information, just a disclaimer, our labor market report that we pull external salary comparisons from, it does lag a year. So this year, we're reporting on information from 2021, not 2022.
That's on the external.
That's on the external, yes.
Yeah, and I think of one thing to point out too, that if we have a turnover that's going to another job, not retiring, those things, and they're more than likely going to an external area, because that's where the demand is for more labor right now because of the economic growth in our community. I don't see that letting up at all for the next 2 or 3 years. And so they're not going to another county, or they're not going to, now law enforcement may be a little bit different because it's so specific, but going to the other PDs or joining counties, many of them are going to Amazon and, these companies that are coming in here that traditionally pay a little higher salary. It's, different kind of work by a long shot, different culture. But at least the way I'm looking at it is, it's good to have that county information, but right now our biggest competitor for employees is external, in my opinion.
I would agree with you. We have a lot of great private employers in our area or considering coming to our area. And so I think keeping a pulse on those private employer salaries is really critical to maintaining the effectiveness of our salary program. And so I highlight that lag in data and that it's a year behind, just so that we know 1.8 seems
Right.
great, but it's not something that we should remain comfortable with. We probably still need to be.
Commissioner Smith?
Yeah, I don't want to dwell on it, but back on page 5 on our comparable counties, I think there are 3 of those that don't need to be in the list for comparable counties. When you're talking about 150,000 population difference, Bell County, Brazoria County, Galveston County, I'm not sure how those really should match up with us, to be quite honest with you. That's just my opinion, but that's a lot of difference in population.
Sorry, sir, you said Bell, Brazoria, and Galveston? Is that correct? Okay.
Yeah, almost 378,000, 385,000, and 350,000. That just seems way out of line for our size. That's just my opinion. And I don't know how that skews the numbers one way or the other as far as salaries or anything else. They just don't look comparable to me, and that's my opinion, so.
Yes, sir. And so I can reevaluate kind of groupings of counties that, because counties grow at different paces. And so every now and again, it's probably best to review our comparisons and see if the county list that we compare to is still the best group of counties. And so we can.
You know, as large as Bell County is, I would almost consider them a competitor about, you know. so
They
I think-
are,
I think
they're
we've
within a
got-
driving
Yeah,
distance.
and that would have been,
We've gotta, I think we have to be, you know,
proximity has something to do with
proximity
it.
has a lot.
Yeah.
And I think the odds of finding a county that has a population within 50 or 60 of ours, you're gonna be looking a long and hard time there.
Yeah.
Because we're kind of a unique, we're still a really small, big county.
There's 6 of them without those 3 that were within 30 to 50,000. And that's just, like I said, I don't know how that skews the numbers. I know the larger they get, generally, they have fewer employees or more representation per employee. And that could make it look like, you know, one way or the other, anyhow, so.
I definitely wouldn't pull Bell County out,
No.
based on that, just because they're such a direct competitor of ours. And, you know, there's many industries that I've talked to that are looking to locate on I-35 but don't be in the big city. And we are absolutely are fighting with Bell County almost every time. So,
And I will say for Bell County, and it's not, I can't say that it's for every position, but more often than not, when we're reviewing Bell County salaries, they're actually lower than ours. So even though they are servicing a larger population, surprisingly, a lot of their salaries are lower than ours. So, but yes, definitely worth a review of counties just to be sure they remain relevant to our comparison. We reviewed kind of where our salaries stack up just on an organization level. So that brings us to our cost of living adjustment. This is just a review of how HR compiles the information straight from the Bureau of Labor Statistics, what CPI we're using specifically when we're plugging it into the cost of living adjustment formula. This formula is directly from the Social Security Administration, and we try to mirror their calculation in the formula to a T. The only variation is the period of time that we're measuring. Not the duration, it's still a 3-month comparison, but our fiscal year differs from the federal government. So we account for that and we kind of adjust. And right now, the most recent information that we have available for the Consumer Price Index is from May. And so that's what we're working with. And then these are the COLA estimates that HR has compiled for fiscal year 2024. I've included three estimates. One is a fiscal year to date that includes these Consumer Price Index from the Bureau of Labor Statistics from October to May. And you can see that's a 5.73%.
of the past year,
So from October 2022 to May 2023.
okay, thank you.
And we have in the middle there of the screen a 4.25% projection, and that's based off of the most recent quarter of available information, which is March, April, May. And so again, the quarter time frame or duration is what Social Security Administration uses for their COLA calculation. And then that third one, this is a third-party projection. This is for or from the Senior Citizens League. It's a large nonpartisan senior group. Every almost economic journal or news article that tries to guess at the cost of living adjustment projection, you can, if you read the article, they're just referencing this group's information. So I've narrowed it down, just directly included their their specific projection. And I also included a history of their projections in the past and the subsequent COLA that the Social Security Administration did issue, and they're pretty close. I will say their projection is national, not regional. And when in the past I pulled regional information, which is available through the Bureau of Labor Statistics, and it's the southeast region that Texas is included in, typically that is a higher projection than the national projection. So I wouldn't only rely on this third-party projection because that's at a national level.
So then what are we saying as today? If you had to quote what the COLA is, or cost of living, or what the inflation rate is right now, nationally and in Texas, what would those two numbers be?
Well, based off the last 3 quarters, which is the most recent information that we have, it'd be that 4.25%.
And that's nationally.
That's the national figure, and it would be higher for our regional.
But it is trending down,
It has been trending down
because inflation
since
is
January.
curbing.
It's come down, right?
Yes.
People are buying chickens and raising their own eggs.
All right.
Right. And so I think the Senior Citizens League group has kind of economists on staff, and so that's why theirs is much lower than, because they have a way to calculate their projection for the end of year, where we just have the most 3 recent months, which is at that 4.25. It has been trending downward since January, but typically, again, our region is slightly higher, even if it is trending downward.
So that Senior Citizen League is saying their projection is for 2023, at the end of this year, that our inflation rate will be down to 2.7?
Yes, sir.
And, well, down to 2.7 or an average of
And not the
2.7?
inflation,
Yeah, or
their
an
cost of
it-
living adjustment prediction is 2.7.
That's the COLA projection.
that's-
Inflation rate was what, will be what? Is inflation rate and cost of living adjustment, that's 2 different numbers, so.
They are,
Won't affect
because
that.
that inflation rate is kind of a snapshot, or could be a snapshot of what's occurring at this moment compared to this moment last year. And they're projecting just overall, everybody's experience, a 2.7% increase in the cost of goods.
I would have thought it'd been higher. Okay.
I have a question, just for clarification. On the Bureau of Labor Statistics, do they, when they're calculating the COLA, are they just looking at prices across the country?
They are, and they are calculating not a COLA, they're calculating just the consumer price index. And so that's that benchmark to which they compare the price of goods, so.
Okay, they're just looking at the cost of goods. The third-party projection, they're looking at the price of goods, but then are you saying they also have economists who are kind of projecting out? Okay, so theirs is not just pure figures.
Right.
Theirs is also projecting out?
They have their own formula and system of how they're figuring that out.
Okay.
They wouldn't be just basing it on these monthly figures that I have from the Bureau of Labor Statistics, where I'm just plugging in the CPIs for each month that are released mid-month for the previous month. I'm plugging them into the formula, and this is how I get the projection. And that's based off Social Security Administration's formula.
June data will be released tomorrow also too.
Okay, good. That's a
Yeah.
good question I had. That's national, I guess.
That's the big CPI.
Yeah.
And if the court would like to see what these estimates look like in actual budget figures,
Right.
Francis and Haley can pull that up in a spreadsheet
Okay.
if you would like to see numbers.
I think at this point, I mean, we can look at it if we want to, but it's gonna come into play when we get back into, get through all the compensation adjustments that are made in the whole county, and then, at least for me, and then look at the effects on that of cost of living, and get through the discussion with our health program, health insurance, and all that kind of goes together, because if you raise one and lower the other one, what the take-home might be adjusted, or benefits could be adjusted, so I'd like to see where we're gonna, after we go through all this, where the employee's gonna end up compared to the prior year.
Okay.
Because we're gonna look at that after we look at turnover, and then what some of our partner groups, like the City of Waco, Clinton County Appraisal District, Health District, and all those, what they're doing too, that, you know, that plays in a little bit. So in other communities.
Yes, sir, and I can plug in the June CPI release as well to update that.
If my
projection.
recollection serves me, the city of Waco is recommending a 5%. I think I saw that in today's paper.
That's right, yeah, and there again, they're analyzing benefits too. I talked to one of the city council persons yesterday. And so that, you know, the final decision like ours is not made till they vote on the deal. But that's, yes, that is the indication. I think it's the indication for McCad right now. But like Hewitt is gonna be higher because they got way behind. So you gotta understand whether they're trying to catch up or whether they're using current data.
Yeah, I think that's important. Because last year's, ours was a catch-up.
It was.
So, do we really need to go that high? Obviously, we don't need to go that high again, because we've seen to catch up.
And, you know, what we
But
did.
we don't wanna, I guess we don't wanna necessarily need to get behind or
Right.
anything like that. So we're in the position to have to give the,
So we actually went over by 0.85 basis points over and above. So to the employee, let's say if you're in the 50,000 to 70,000 range, it was 500, you know, a little less than $500 up to $700 over and above their cost of living, and there was no increase in their benefits. And they're guaranteed the return on their retirement at 7%. And we had, you know, so we did a little bit more than actually what the numbers showed that we could have done. So we'll take that into consideration. And our objective is to be competitive in all those things. But we need to be sure we look at it as the whole package, like an employee gets their payroll acknowledgement, that they can actually see what it means after benefits and all those things are. Any other questions or comments?
I have been disconnected and I'm logging back on so I can bring the presentation back up. Okay. So we'll continue to monitor that as information comes out. This next, you say, looking at the whole package, and so our next component here of our compensation package is our incentive pay program. This year, the court approved the continuation of the incentive pay program and the funding for that. We're compiling the incentive pay list now, actually, and so we have 355 employees eligible through these pay lists who are set to receive some incentive pay, some amount of incentive pay. And so the 2% budget for this year is $568,000, but, and I have a history there of the total incentive payout. This is purely based on salary. And then Francis actually has an actual complete figure with benefits, or with taxes and whatnot included. a quick note, just as we talk about, remaining competitive with our base salary information, employers are also looking at increases and adjustments to their form of merit pay programs. And so I've included information from SHRM, or the Society for Human Resources Management, and it looks like for this year, U.S. employers are reporting merit increases on an average of 3.8%. And so employers are looking, just like the court is, other employers are also looking at their entire compensation package to make sure each component is competitive, including merit pay programs. Did anybody want to see the figure from Francis before we move on?
I can just add to it. I know that number, like Anna mentioned, is just the 2% flat on the salary amounts. If we added juvenile in as well, because juvenile mirrors the policies that you apply to all other employees, as well as our office as well, but juvenile being that other big piece. So if we add that in, and then add benefits and taxes on there, retirement, FICA, Medicare, it comes right about an $850,000 total package. And that's calculated on all positions at max level. So we know that a lot of these positions will be vacant, or they won't be eligible for some reason, but that would be the all-in number.
How much again?
For about $850,000.
Okay, thank you.
And
So that would be-
what is that number again?
So that would be if you wanted to put 2% in for all current positions right now at the current salary. And that would be all general, all positions, including juvenile, and that would have all of the taxes and benefits added in as well.
So Commissioner Smith, that's for next year, this coming budget year, so discussion now or later on doing the program, staying with it or doing something else would be appropriate now or later on in the budget process. Maybe when we try to decide what COLA is and all those other things, but it's up to you. Dave.
Is 850 for 23 or for 24?
That would be for 24 if you wanted, if just looking at an all-in number.
Did you use COLA in there?
No, so that's just
Okay.
on current
That'd be higher than
positions. So if you add just say, you said 5, if you added a 5% COLA, increase those by 5%. But again, looking at what actually gets paid out, because vacancies and employees that aren't eligible, if you're looking to put that in the budget, we can work together to try to come down to a number that is more reasonable, that we think
We can,
this is vacant, we probably won't be paying
Sure.
incentive pay on this position next year, so,
we can pull maybe a history of like the percentage of positions that do end up eligible for incentive pay, to try to get an estimate of what the actual payout would be for fiscal year 24.
But if you add COLA, you can just assume it's gonna be 900 and something thousand for 24.
And that's all
What is
positions,
your-
but not
what-
include,
What does this slide reflect?
So this
I'm a little unclear on this slide.
This table with all these past figures, this is the amount of payout following removal of all those ineligible positions. So we might budget $500,000, but this ends up being the result of the
Commissioner
program
Bowe.
at the end of the year.
your 850 figure, that's for all civilian positions, right?
yes, any that are
Okay.
eligible for incentive pay per the
Okay.
policy. So again, it's the max number, but just if you were looking to put it into next year's budget, just a number we would start at, and then
Okay.
can adjust accordingly. But the taxes and the retirement especially, that bulks it up quickly when you add those pieces on. You're looking at another like 25%, probably almost, in FICA, Medicare, Social Security, retirement.
Okay.
It does have a hefty price tag. But yes, if the court wants to let me know any notes or questions they have, just to get a better picture of what that might look like next year, I can work with Francis and
I think you hit on it, so I'm anxious to see what you come back with, because we never have distributed the incentive pay to all eligible employees. It looks like it's always been a percentage of that group. So I'd like to see what that history looks like.
Yes, ma'am. Moving on to the next component of our compensation package is our health plan. We have information from our last report from our health plan consultant with Hub, Randy McGraw, sharing that there's an expected gap in funding, so there is a need for a contribution increase. So before Randy and you, the court, start getting into kind of what options best fit the county, I first wanted to just provide some context for what other, by providing information on what other employers in our area are providing through their health plan, and also give a kind of national or nationwide figure there. So that first table you see there is a health plan competitiveness. It lists our base plan, which is our more popular plan. We have about 70% of our plan members on the base plan. It is our more expensive plan. I've isolated this plan for comparison, and I've pulled plan premium information from the state of Texas, who have all benefits through ERS or the Employee Retirement System, City of Waco, Clayton Homes, HOT Behavioral Network, and Atmos Energy. And we've reviewed their benefit plans and try to pull a comparable or similar plan to this base plan of ours. All those numbers in red indicate premiums that are lower than our plan for the same tier level or coverage level. So employee spouse, I list employee only, employee spouse, employee children, and employee family. Below that, this is from the Bureau. This is information from the Bureau of Labor Statistics. They also report on a nationwide average for state and local government annual employee cost. So you can see this past year in 2022, on average, state and local government employers paid $13,561.60 per employee. And that's to provide health and life and short-term and long-term disability. For the county, just based on contributions, what the county contributes, ours is closer to $7,800. And so I offer that for comparison before getting into those conversations about plan changes that may affect our employees and their premiums.
Okay, explain to me the rationale that we use other counties for salary comparison, but when we get to health benefits, we use private employers and the state of Texas and Behavioral Health Network. Why can't we get from those counties their contribution per employee?
We can get that information and request it from them.
Yeah, in other words, if we're doing 7807 per employee, what are those other counties doing per employee?
Okay.
Seem like to me that would be a more of an apples and apples,
And
or maybe I'm wrong.
And I believe in what Randy will share with us today. He'll include not our comparable counties, but counties that he works with. He'll provide some county comparison information. But we can provide that, and it's mostly just to include information about external employers here in our area.
Well, that's
which-
our competitors. I mean, I
that-
hate to say this, sound flippant, but I could care less what Galveston County's doing because we're not competing with them.
But we're comparing them for salaries.
Well, because you gotta have a baseline of some kind.
In part, we are.
Yeah,
because we also comparing to external. So we're using in
Yeah,
that
so it's
three
a
phase.
combination of all that. She's just doing an overview, but when we see that, we see county comparison, we see market salary, we see
Internal comparison.
internal, so it's all inclusive. This is just, I think, your 10,000-foot.
But I'd like to see what, if we're gonna use Bell County as a benchmark, or not a benchmark, but we're gonna keep Bell County in, then what's Bell County doing for their employees, per employee?
Right,
If we're trying to compete with them for employees.
sure.
Well, I think, Commissioner, it's kind of hard to compare yourself. Salaries are one thing, but people, these job functions that are performed at the county, you're not gonna find them at Walmart. or at,
Amazon, yeah.
Costco or anywhere. You're not gonna find them. So I think she's pulling from information, trying to give it a more accurate look at who do we compete with?
It's just a local view, because I've given the kind of national figure in the past, but it doesn't feel like it wasn't as helpful to the court, so I'm just adding another piece of information there on a local view of how our premiums stack up. And it is just a premium view. These other plans could have I tried to find comparable plans, but ultimately they are still different plans. And so getting a kind of plan-to-plan comparison that is exact is difficult. But I think what is more concerning to an employee is what is coming out of pocket to them and how they are directly affected. And so that was,
I would say if we do compare like other counties, that we also look at what their retirement plan is, because that's part of the package, right?
Total package.
Yeah, and so, we have a multiple of what we match in that, and then there's a guarantee from TCDRS for return on the investment of 7%. And so, when you're looking at the overall package, health is one thing, and it's a short-term contingency to an employee, and retirement's a longer term, but still they affect each other, and you can move dollars across those lines.
yes, I think other counties may vary in the percentage of matching or required contribution from the employee. And so I feel like that's not a difficult thing to get or compile for you. We now have, and I've already kind of
I have
provided.
one quick question about
Sure.
slide 10, on the short-term and long-term disability. How much do those run normally? I can't remember off the top of my head.
For the employee and their cost, it's going to vary because it depends on each employee's age and salary. So each employee has a tailored premium. So there's not a one answer, I guess, to.
Okay.
So moving into more so kind of what the court is facing now with our health plan. We have, our health fund is needing to be increased by 29.9%, or 2.42 million, according to Hub's projection. And we did ask Randy to join us to give us just a brief overview of what was last discussed, where we are now, and possible solutions for the court and how to approach this funding need for the health plan. Randy, are you on?
Yes.
Good morning.
Good morning.
I'm going to stop sharing my screen, Randy, if you want to share yours in your presentation.
Sure. So, good morning, Judge, Commissioners. I'm Randy McGraw with Hub International.
Right.
And it's it's been interesting discussion so far. I made a couple of notes based on some of Anna's comments, and one of them you just picked up on too, on that slide number 10, So when I look at slide 10, it does look like it's comparing on a national basis the cost to the employer of the employee benefits package. And of course, it has that note including short-term and long-term disability. And the differential between McLennan County and the 2023 number is close to $6,000 in a year. And I can promise you that the cost of short-term disability and long-term disability does not average $500 per month paid by an employer. So I would attribute the big difference in those numbers on page 10 to be tied to the employer side of the contribution or the cost of the health plan. Just an observation on that one. And then also on page 5, to reiterate Anna's comments there, we can certainly go back and drill down on whichever of the comparable counties you would like to have in a comparison and provide you with some additional information on what their benefit plans look like. So with that, I will proceed with what I hope is informative information for you. And I'll go rather quickly through some of the earlier points in the presentation so we can spend more time discussing alternatives and concepts at the end if you like. But feel free to stop me at any point if you have any questions or comments. So when I was last in Waco and we gave you a forecast for the projections for both the fiscal year and plan year 24 on the health plan, there was another month's worth of data that was just on the horizon for the month of May, which has come through, and we have incorporated it, and it did not materially change the forecast from where we were. It actually inched it up just a notch. So I've divided the comments in the presentation into 3 categories, just a quick synopsis of how did we get to this point in the road. Take a look at some of the other county information that we rounded up, and this would be based on counties that our consulting team works with. And then we have several funding and plan design alternatives for your consideration as well. So in our journey to get here, the county had a long history of working with Baylor Scott & White on its health plans. And in the year 2020, we conducted an RFP process. And the result of that process was a change in the administrator of the plan from Baylor Scott & White to United Healthcare, UHC. And that change took place on January 1 of 2021. And once we made that change, we noticed immediately, which the RFP analysis indicated would happen, that there was a pretty serious decline in the cost of medical claims. And part of that's due to a change in your risk, but the majority of it was just due to a change in your claims administrator's ability to negotiate price with hospitals, doctors, et cetera. However, we also at the same time noticed a pretty alarming rate of increase on the pharmacy costs. But one thing that has been present all along is that, and noted again in Anna's presentation, payroll deductions for employees at the county has not changed in 8 years. And so if you were to go out and do a survey of other employer plans, whether they're state and local government, regional, neighbors, all across Texas, all across the nation, I think you'd be hard pressed to find any or many employers where payroll deductions for their employee benefits haven't changed in 8 years. So that's a great accomplishment on behalf of the county. Now, that does not mean that during the course of those 8 years that the county didn't contribute some additional money, but they haven't been every year that's come along, and it's been several years now since the county increased any of its contributions to the health plan. So here's just a couple of charts to kind of give you a visual image of where we are and how we got here. So in this right below the blue arrow here, you can see that's January 1 of 2021. And these are the moving average costs of our two plans that we offer. We offer a base plan, which again accommodates about 70% of your participation. And HDP is the high deductible plan, which is the remainder. And so you can see the green line is the average cost of medical and prescription drugs for the base plan. And I'm sorry, the green line is the consumer-driven health plan, and the blue line is the base plan. And historically, you would on the norm, you would see these two lines inverted. That typically the base plan is a higher cost than the consumer-driven health plan. But part of what we're seeing here is that there's just a fairly low level of enrollment in the high deductible health plan. So whether if there's a large claim in a year or not a very large claim, it can kind of skew those statistics. One of the things we can see in the chart here is that over time, the two are starting to converge, which we have had some growth in the consumer-driven health plan, but it's not, at what I would call critical mass. When we take a look at your contributions over time, here we've got several years, 2021, 22, these are calendar years. And then for 23 year to date, we're up to May of 2023. And so if we look at this chart, we can see that the county's contribution, again, hasn't materially changed, nor has any contributions coming in from employees or retirees. And so they've held steady over that time. And you can see we've had about $8 million worth of revenue in both 2021 and 2022. And if we stay this current course that we're on, we'll have another $8 million in 2024. On the expense side of the equation, we can see in that first year that we had a net gain of about $800,000 revenue over expense. But in 2022, we had a net loss of 1.4 million. So far year to date, we're about a net loss of 900,000. And our projection, if we do nothing except continue to do the same things we're doing now, is we'd incur a net loss of about 2.8 million in 2024. So I would refer to this phenomenon as a funding gap. Revenues aren't keeping up with expenses. Here is a pace of inflation. Speaking of pace of inflation, it always cracks me up, and when we're looking at like the COLA or the inflation rates that are being discussed at a national level, you know, that last year we were at 9% or whatever, and now we're at 5%, and we're supposed to be happy that we're at 5%. It's not that the cost of goods went down. It's just that they're not going up as fast. And so we're all familiar with that because it impacts all of us in everything that we look at. On this chart now, what we're seeing is how the pace of inflation changed starting on January of 2021. So right off the bat, we can see that prescription drug utilization started to increase, and it more than doubled in the first year. And on the medical side of the equation, the medical claims expense, it fell almost 30% as we approached the end of the first year with United Healthcare. In 2021, in the world of health insurance, the first quarter of the year, the majority of claims being paid in January, February, March were actually incurred in 2020. So those were old Scott and White claims coming through. And you can see on this chart how our blue line kind of stayed constant. So the pipeline began to fill up with lower cost claims from United Healthcare, but they were being offset with the higher cost claims coming in from Baylor Scott and White. Once you see that period of run-in, or we call it run-in or run-out, depending on what side of the table you're on, once that period of time has expired, you can see our cost of claims decline dramatically in terms of the rate of change. Up until mid-2022 is the overall trend or pace of inflation for medical and prescription drug was in positive territory. And then we've had we'll talk a little bit more about what's driving it on the cost side of the equation. So the prescription drug expense has abated somewhat and is coming back down to more realistic level, except that we're talking about 20% of the cost of a claim higher than it was a year ago, which was higher than it was the year before that too. So what's causing these claims? So one thing to look at is, well, maybe we just have a lot of really high cost claimants. And the answer to that question is no, we actually don't. So here in this chart, it's showing you your ranking of the highest cost claimants on the plan all the way back to 2020. When we look down here in the bottom portion, it says the number of claimants that met ISL. ISL is the individual stop loss limit. And that's the point at where the stop loss carrier assumes the risk and the county stops assuming the risk. So for all 4 years, our stop loss deductible is $175,000. In 2020, we had 5 people exceed that, 21, 1, 7 people in 2022. So that's part of the cost driver that we could see in the pace of inflation going into the year 2022. And so far, in the first 5 months of the year, we've got nobody in excess of the stop loss deductible. So what this is telling us is that this really isn't a function of really high cost claims that are impacting the plan. Well, if it's not the high cost claimants, then what is it? So this is a chart that was prepared by United Healthcare, where they're comparing 2021 and 2022 results from McLennan County against their book of business. And so their book of business is adjusted to reflect governmental entities in Texas is who they're comparing you against. And so, of course, in this chart, things that are in the green zone are all good, and things that are in the red zone are areas that we need to look at. And so when we look at this chart, it's like, well, the overall cost we pay per member per month, which is a good benchmark comparison across plans, we're way up here in the green zone. We're way more favorable than half of the clients in United Healthcare's book of business. So that's on what did it cost the plan. On what did it cost the member, that's what cost share is. You compare very favorably. So what this is telling you is your benefits compared to their book of business are good, meaning your deductibles are overall lower, your co-pays are overall lower, your out-of-pocket expenses are overall lower. The one area that jumps off the page is the prevalence of emergency room visits. It seems like we have a lot of emergency room visits compared to the peers, and there's a lot more data to drill down to and take a look at that. And we've rounded up additional communication and educational pieces to pass out to the public or to your members in the plan to try and encourage efficient decisions on what we'd call the site of care, which is, do I need to call a nurse? Should I go to urgent care? Do I need to run to the emergency room? Can I see my primary care physician? Where should I go to seek my care? And your population overwhelmingly dashes to the emergency room. So that's an area that we can focus on, but that's not $2 million worth of claims expense. The percent of PCP engagement, PCP is primary care physician. And so the concept is the better relationship you have with your primary care physician, the better job you're doing to try to prevent the progression of chronic disease or chronic illnesses or other conditions. So we score good in that category. MSK is musculoskeletal. And this is a disease category that captures a lot of prescription drug utilization, especially for rheumatoid arthritis and things like that. And so in our MSK, we're in the higher end of the range, which again is an area to focus on in terms of programs, concepts, and communication with members on how to manage their care. But there's nothing on this page that just says you're overwhelmingly a worse risk than the majority of their book of business. So we still have the question of, so what's causing this? this is what United Healthcare's observations are. They picked up on the trend going up 30% in that year 2022 compared to 21. They point out that you had more catastrophic claims in 2022, which we saw that on the list. We saw that in 2022 you had 7, so they can count to 7. And then in the pharmacy side, as the chart indicated, that's where claims expense jumped off the list at the top. And Ozempic was the drug with the highest overall increase. And we had a short discussion on Ozempic when I was there at Commissioner's Court about a month ago. And it's been a topic of discussion for several months in our regular meetings with United Healthcare. And we're seeing the jump in Ozempic prescription drug use high across the board in our entire book of business, regardless of who the pharmacy benefit manager is. And frankly, it's not as bad in McLennan County as we see in other pockets of Texas, where it's just like there must be a drive-through pharmacy, and that's where all the Ozempic is, where people can just drive by and get it because it's flying off the shelves down in the coastal Bend area. But again, Ozempic's not accounting for a need for $2 million worth of claims expense. So then what is it that's doing it? So based on all of the other metrics that we've taken a look at, it's just that you have more people using the health plan than you've had in the past, and more people using it at a higher level than they've used it in the past, but they're not using it at an extreme level with high cost claimants or severe cases like that. It's just a case of more people using more benefits, which is the purpose of the health plan. It's just a phenomenon that we haven't seen, and it appears to be like it's going to start leveling out, but it would be better if it leveled out at a lower level. So I'll pause here for a moment before I go into any other, the next section, in case you have any questions or comments.
Any questions?
Go ahead. Go ahead. Go ahead.
Okay.
I have a question. When
Sure.
you look at the years that we're comparing, and we're doing 20, 21, and 22, those are COVID years. And I'm wondering, my question to you is, in 20 and 21, when they sort of shut things down and people really weren't going to the doctor for preventive care, they were kind of going if something came up, then they probably went into the doctor. But for the most part, people just kind of shied away. And so I thought I would see maybe prescription or pharmacy charges stay kind of consistent, but it looks like those went down too. So I'm wondering, did that have an effect? And then as they've opened things back up, are people now kind of catching up, going back to the doctor and going back to the dentist?
So those are all good observations. And in 2020, when the lockdowns were happening and hospitals stopped accepting admissions for anything other than, acute care, there was a dip in utilization. And like you observed too, the dip mainly happened on physical interactions between members and doctors, dentists, and hospitals. And so we saw the utilization dip from about May of 2020 to about November of 2020, where people just didn't go to the doctor. But like you also observed, they were still able to get their prescription drugs, and pharmacies responded quickly to the environment by offering home delivery and things like that. So you didn't see the same, in the industry, we would just refer to it as abated claims. So they were claims that probably would have happened, but because they didn't meet the acute care definition, they just got postponed or abated. And you sometimes see that same phenomena in other big natural disasters. So in the industry, some of the comparisons that we were looking at was what happened when Hurricane Katrina hit New Orleans. And you saw the, access. I mean, they were actually evacuating hospitals back then. So you saw the same pattern of abatement and then a same pattern of return. And so the return back to seeking care began to pick up in 2021, and then it continued into 2022. But for the most part, industry-wide, we figure that patterns of utilization are back to normal right now, or back to what you would have expected. And so that gyration from the pandemic has pretty well run its course. It doesn't mean that COVID is gone, but we're just not seeing it in the high same prevalent rate.
So is it not so much an increase, but a return to the activity? Like if we look pre-COVID, would we see kind of what we're seeing coming into 23? As far as utilization of the plan?
Yes, but at a higher level. So in other words, a lot of the benchmarks the industry uses is what's the cost per employee, or what's the rate of admissions per employees. And so we're seeing, in terms of the frequency that an employee sees a health plan provider, the frequency is about the same. But let's say that in the past we might have had on average 1,000 people seeking care on average in 2019, and now it would be more like 1,200. So it's just that more people are using the plan and using it at a steady basis. It's not like they just returned and then things stop. But we're just seeing more people are using the plan, and they're using it at an overall higher level than they used it before. But compared to your peers, you're still doing better than them, which is okay when you're looking at a report from United Healthcare. But that doesn't do us any good, because at McLennan County, we're seeing, the cost, to the health plan going up when it's not going up as much as in other areas. And part of that's just driven by the fact that we haven't been changing payroll deductions or county contributions because the plan had been performing well.
Thank you.
Sure.
Stop loss, question, please, sir.
Yes, sir.
The stop loss is 175,000?
Yes, sir.
Okay, and explain to me again, anything that, once it hits 175,000, you said the carrier starts picking up the cost and the county doesn't assume the cost anymore, or something of that nature, Randy, is that right?
Yes, sir. You described it very well. So the stop loss contract runs on a calendar year. And so basically any one person, and so the county deductible is $175,000, means the county pays the expense up to that threshold. And we purchased our stop loss coverage from United Healthcare. In the past with Baylor Scott and White, we had to purchase it from separate companies. And when we had it in the past with Baylor Scott and White, if we had, let's say in 2020, this $331,000 claim, then the county had to pay the whole $331,000, and then paperwork would be submitted to Baylor Scott and White, who would give it to the stop loss carrier, and then they would send you back the difference. Under United Healthcare, we're purchasing the coverage from United Healthcare so that when the claim hits the 1 penny over 175,000, starting with that 1 penny and everything after that, it immediately starts to get paid by United Healthcare. So it's the same deductible, but there's better cash flow under United Healthcare, and that the reimbursement is immediate, as opposed to in the past you would sometimes maybe take 60 to 120 days to get your money back. But yes, essentially anything over any one person under the plan greater than 175 is borne by the carrier.
Well, the comment and the question then, if we're setting it zero, theoretically, you could have a bunch of $174,000 claims that would be a driver for the cost to the county, correct?
Yes, sir.
and never reach that bound. And then who determines the 175? Is that a number that is agreeable between the county and the carrier, and we pay a certain amount for that 175 as opposed to 165 or 125 or 200?
Sure.
How is that negotiated?
So this would be done through your, originally it's done through your RFP process. So you solicit proposals and you don't have to buy your stop loss coverage from United Healthcare. If there's other carriers that give you a proposal that's better, then you could purchase it from them. So you're not obligated to buy it from United Healthcare, and that contract renews annually. And so the amount of the deductible is basically determined by the county. And so the county says, we currently have, typically you'd say we currently have $175,000 deductible. And in the RFP, we'd say, give us bids on 175,000. Show us what it would look like at 185, 190, 200, et cetera. And we can go the other direction too and say, tell us what it would look like if it was 150 or whatever. And so when we do the RFP process, we ask for a range of deductibles, and then we do a risk versus cost versus benefit analysis to determine which one is the best choice. So in other words, if let's say we're looking at 2022, and we know we had 7 people exceed the 175, and we're looking at this list here. And number 7 was at 178. Here's one at 181. But let's say that there's 5 people that are over 200,000. So in this bid, we might say, what would your rate be if your deductible was 200,000? And of course, it's going to be lower. And so then you would say, well, if it was 200,000 and we had the same pattern appear right here, then it's pretty easy. We can go back and see what our new liability would be, because anything above $200,000, we're going to end up paying another $25,000 per person. And so in this case, there's 5 of them over that. So let's say they come in and say, all right, we'll lower your rate by $100,000 if you buy the $200,000 deductible. And then we say, okay, but or let's say if they're gonna lower it by let's say 100,000, but we're gonna pick up liability of 125. So that may not be such a good trade, but that's the process we go through each time. So it's not a case of the carrier telling you what you will do. It's a case of the county investigating options and picking which one is the best one for you.
Thank you.
Sure.
Any other questions? All right. May proceed.
Okay. So here's just a little bit of information on what these are our other counties that my team manages here in the state. There's, of course, McLennan, Cameron County down in Brownsville, Ector County, Odessa, El Paso County here, Webb County, and Laredo. I think I saw Webb County on your list of comparable counties that you had on your list, but none of these others fall within that range, and we could certainly go and collect the information on them. But one of the things too, this is really just a comment about what do these types of comparisons tell you? And really the only thing they tell you is what is the payroll deduction cost. That's the only thing that you know is a hard fact when you look at a table like this. There are a lot of other things going on behind the scenes, like what we just saw in our history of how did we get here. And so those are some things that you might need to know in order to determine, are these good or bad numbers or what's really happening here. So I provided some additional snapshot statistics too. First one is the total number of members, and this is not employees. This is total of people covered under the plan. And at McLennan County, we offer 2 plans. I have traditional as your base plan. It's a regular PPO. Consumer-driven health plan is a high deductible health plan with a health savings account. And so there you can see what our current payroll deductions are. These are all monthly. And then what they would be proposed to be if there was to be a 30% increase. And then to compare against Cameron County Cameron County doesn't offer a consumer-driven health plan. Instead, they offer an ACO and a traditional plan. So the traditional plan is like your traditional plan. It's a PPO, has deductibles, co-pays, co-insurance, etc. Your plan does not have out-of-network benefits, and Cameron County does, but hardly any claims go out of network. So as shaded in green, any of the categories that were lower payroll deduction costs compared to McLennan County, and practically every one of those in Cameron County is at a lower cost. Ector County is different. They only have 2 tiers for coverage. And so regardless if you have just 1 kid or a spouse and 10 kids, it's the same payroll deduction for everybody. And they've been doing this for like 15 years or so, and they're pretty conservative county as well. And they just don't adopt to change very quickly. And in their health plan too, they budget for it differently as well. So in both Cameron County and Ector County come up with a dollar amount that they contribute toward the cost of care based on the number of active employees, nothing about retirees. So for example, at Ector County, they budget $900 per active employee, and that's the money that gets spread out toward contributions on employees and retirees, even though there's no budget factor for retirees. So it's a different way that they budget. Cameron County follows the same concept, and they budget $750 per active employee. They budget nothing toward their retirees. El Paso County has 2 plans similar to yours, consumer-driven and traditional. They budget similar to yours, where you have an amount that you contribute per employee. And then El Paso County also subsidizes the cost of dependent care. Their target originally was 20%, but as they went through the pandemic, they began to subsidize costs even higher. And then Webb County budgets in a similar fashion of Cameron and Ector County, where they come up again with a baseline amount for active employees, and then that counts as contributions towards retirees as well. They only have 2 retirees on their health plan. And then they have a low plan and a high plan. Both of them are traditional PPOs. So if you only looked at the top part of this grid, you would say, wow, you know, these people have lower cost of health insurance. What's wrong with McLennan County? Maybe we need to fire United Healthcare and see if there's something better. So this information down below gives you some more insight. So the per member per month comparison, this is what it actually costs between our 2 plans on average covered person under the plan. So our costs are $420 and $493. And then when we look at the traditional part over here at Cameron County, they're at $435 and $758. So let's see, the plan actually costs more than yours, but payroll deductions are lower. That means that regardless of the process Cameron County uses, they're subsidizing the cost of care higher than McLennan County. And then the other thing that Cameron County does is that they typically underfund their plan by about $2 million to $3 million per year. And then at the end of the year, they just transfer money from the general fund over to the health plan to zero it out. And then they start the next year, and the process repeats itself. So at McLennan County, when we first moved into the self-funded environment, that was kind of what was happening too, because the discussion with Commissioners Court usually sounds something like this, is that the county needs to increase its contribution to cover the cost of care and stop a deficit. And then the county says, well, how much is that going to be? Well, we need to increase rates by 30%. Okay, well then, but that's too expensive. It's like, yeah, but you're already paying it. You're paying it by transferring from the general fund. What we're talking about doing is budgeting for it. And so that's kind of the conversation we're having right now today is you're subsidizing the plan when it's upside down in the last couple of years, because your general fund or the fund within the health plan backs up the losses. And we've been blessed with a good fund in the health plan, but because of the deficits we're experiencing, that is starting to approach zero. And from a budget perspective, it would be good to budget and have an expectation of what you're going to spend, as opposed to wait halfway through the year and find out, wow, we ran out of money. We're going to have to transfer money from the general fund. So in Ector County, you can see it's the same thing. The payroll deductions are lower than yours, but the average cost is right on track with your 493 figure over there. El Paso County, it's kind of a split decision there. The consumer-driven health plan operates well, and the traditional plan is a little bit high. But again, there you can see that even under the traditional plan, when their costs are $70 per month per person higher than yours, payroll deductions are lower, and the reason for that is they're subsidizing it. And they did in 2020 and 2021, they did not recognize any abatement towards utilization. So while the rest of the world was seeing medical claims expense drop in 2020, and here in El Paso, it was skyrocketing at the county. We just had a run of heart conditions, premature babies, brain aneurysms, the worst kinds of claims you can think of were happening. And of course, not pleasant for the member to be going through that too during the pandemic. And then you can kind of see the same thing over here at Webb County as well. Payroll deductions are lower under the traditional plan. They've only got 29 people on the high plan. And our recommendation there is, why even offer it? There's only 29 people, but evidently there's 29 people that are willing to pay much higher rates for that benefit, which doesn't make any sense to me. And they're anticipating a 10% increase in funding here. So when you look at those comparisons, even of your benchmark counties, which we can go back and add some of the ones off of Anna's page 5 in here and pull up the information, we may not be privy to the cost information, but we can pull up the top part of that graph. But the top part only tells part of the story. And then even in these per member per month costs, that's based on year-to-date information. And then down below here, when we take a 12-month moving average, you can see it's the same story. Costs are higher, but payroll deductions are lower, meaning the counties are subsidizing the cost to bring the payroll deduction down. So, I've been talking up the consumer-driven health plan for years, because I do believe that it has a viable impact and a role to play. And so here's a good case example from the county of El Paso, where we introduced our consumer-driven health plan back at the start of 2014, and we had very few people on it, and there was no contribution to the health savings account. They added it reluctantly, I would say. They had 3 plans back then, and this buy-up plan was just out of control cost-wise, and we eventually pulled the plug on that. But you can see that what happens when there's a low enrollment and there's just a few people in there, it can skew the data. But once we got up to 2016, the lines crossed and the consumer-driven health plan became the lower cost alternative in terms of measuring the cost of the plan. And so about this time, we agreed to start contributing $300 per year toward the HSA account, but it just wasn't getting much traction. And so you can see in 2017, we had 601 members under the plan, and we had increased our contribution to $600 in a year. But in 2018, they decided to go ahead and fully commit to the consumer-driven health plan. So we did a couple of things. Is we widened the cost of the payroll deductions between the base plan and the consumer-driven health plan, and we increased the county contribution to the health saving account to $1,200 per year. And so that money in the HSA account can be used by the employees to offset their higher cost of deductibles, because there's no co-pays or first dollar coverage except for preventive care under a consumer-driven health plan. So you can see that one move in 1 year caused a lot of people to say, maybe this isn't such a bad idea, and our enrollment jumped to 1,000 people. And then you can see over time, as there's been some changes, and especially in 2020, or actually let's say 2021. So in 2021, we had to increase some payroll deductions because of their run of high claims. And you can see, and all along the way at each point in the decision, the commissioners would say, maybe we shouldn't be paying so much money into this health savings account because if, that could be money we could use to pay a claim as opposed to making it income or, disposable income for an employee by putting it into their account. But when you look at this graph here, we were at $300 per average on this person, $400. That's a $1,200 a year difference per covered person compared to an increase that we made a few years back of $600 per employee. So the bang for the buck on the contribution of the health saving account each year is the same thing. Should we keep contributing to the HSA? And especially here in this range where the county was hemorrhaging money in the health plan, there was a lot of contemplation to lower it, but they stayed the course. And so you can see while the overall population at the county has remained pretty constant over time, you can see more and more people are adopting the consumer-driven health plan. And that as you would think that as, if a risky person up here, I'm pointing at the wrong chart, if there's a risky person up here on this red line and they move to the blue line, wouldn't that make the red line come up? And so here you can see the magic of the health savings account consumer-driven health plan is that, yeah, if these are all averages and you put them all together, you should end up at the same number. But as people grow and adopt to using the consumer-driven health plan, it changes their perception and it changes their dialogue that they have with their healthcare providers. And you can see even as higher risk claimants move from the base plan to the consumer-driven health plan, you don't see the cost of the consumer-driven health plan matching the same pace of change under the conventional traditional plan. So that's just I guess an argument for making the consumer-driven health plan look more palatable to employees. So this one is not a county, but it's along the I-35 corridor. Some of the participants in the Diocese of Austin are in McLennan County. It's a pretty big geographic area for the Diocese of Austin. And here you can see our consumer-driven health plan is the yellow line, and you can see over the course of time, it's always outperformed the other categories where they have employees. So they basically have a consumer-driven health plan, a high plan, which is better benefits than what you offer right now. Clergy plan is the gold card, as well as the seminarians too. So in the diocese, members of the seminarian plan and the clergy plan have no deductibles, no co-pays, no out-of-pocket expense. So it's like the gold card of health insurance. And then you can see here in our seminarians, this is where we had our retired priest part, and we laid off our retiree risk, Medicare risk to a Medicare Advantage plan, similar to what the McLennan County has been doing. You can see how the cost of claims fell because seminarians are a lot younger than retired priests. And then just FYI, the Diocese of Austin on January 1 of 2024 is going to eliminate their high plan, and they're only going to offer a consumer-driven health plan. It's been such a good outcome for them that's their strategy going forward. And so again, there you can see the majority of people here, it's lopsided. The majority of them are in the consumer-driven health plan. And then some of these others don't have charts and graphs, but it tells the same story. So this is a 5,000 employee school district. There's 7,000 members. Plan 4 is their consumer-driven health plan. And you can see that relative to Plan 2, which is their most popular traditional plan, the average cost there is $633 versus $220, $569 versus $301. So the evidence is stacking up that the more people that are in the consumer-driven health plan, the more stable it becomes mathematically. And you can see the value that it presents when you compare it to other employer groups. The El Paso School District has about 7,000 employees. And the majority of their membership falls in the consumer-driven health plan. And again, you can see over time that it outperforms the traditional plan, even when there's thousands of people in there. So that's part of the thought process behind the discussions and comments that we made at the last Commissioners Court meeting. And we didn't review plan designs or funding live during that meeting, but you had some handouts, and we've narrowed that list down to a couple of different categories. And so this first one would just say, what if there was because we had talked about the need for $2.4 million to bring the fund up to its target desirable level, but the fact that it doesn't have to all be accomplished in 1 year. But one of the things we'd want to try to make sure we do for the county is that we don't let the health fund get into a negative position, because then that means the county has to use its general funds to offset the expense of the health plan. So under this scenario here, rather than increase rates across the board or contributions by 30%, this is meeting it halfway. So this would be a 15% increase in contributions from the county and a 15% increase in contributions through payroll deductions or retiree contributions. And for purposes of putting this on the slide, it's only showing the active employees, but there is backup information with details on the retirees. It's just you wouldn't be able to read it if we put it all on one slide. So, and this would assume that we keep the same current plan designs that we have right now, maintain the same contribution to the health savings account at $600. And then these totals in the grid up above are based on the plan year. So in 2023, the county's total contribution is projected to be $6.6 million. And this does include retirees. They're just not showing up on the graph there. And then in 2024, it would be a $988,000 change on the calendar year basis, and a 15% increase translates to $7.6 million. And then you can see the same math working out on payroll deductions. And on the far right-hand side, you can see what the monthly change in payroll deductions would be. And so in this case here, we would propose still keeping the cost of the single employee-only coverage under the consumer-driven health plan at zero, so that there's an affordable plan for every employee, regardless of their job position or income. And then down below, you can see in this budget impact, this is just taking 1/4 of 2023's numbers, which is the last quarter of the year, plus 3/4 of 2024. And that's what those numbers would look like from a budget perspective. And then I've also added here what we would project the fund balance to be at the end of 2024 if we adopt this model. So that would get us to 1.2 million, or about halfway towards our goal. In another scenario, this shows a lesser contribution to the county and a much lesser contribution from employees. So all of the same logic on the prior slide, except that it's a 10% increase on the county side, 5% increase on the employees. Again, you can see what the monthly changes are, and bearing in mind too that there hasn't been a payroll deduction change in a long time. Maintaining the HSA contribution at $600 per year. And then you can see the impact on a fiscal year basis here at the bottom. There's yet another variation, and we can run pretty much any combination of things that you want. We're just trying to help frame the issue for you. So this one is 15% on the county side, 2.5% on the employee side, same $600 contribution, about $1 million fund balance projected. And I'm going to back up to the prior one. So the fund balance under the 10 and 5 split would be about 780,000, kind of low. Under the 15, 2.5 would be about 1 million, would be where we'd project the fund balance. And so then I have another one that I labeled hub concept. So the first three versions were recommendations coming from your insurance committee and discussions internally there at McLennan County. And then this one is basically my version. We'll call it hub. But this would be my version of how to juggle things to get them back on track. My version's more expensive than any of the other county versions to the actual county side of the equation. But this one would have a 15% budgeted increase in contributions from the county, no change in payroll deductions under the consumer-driven health plan, a 5% increase on the base plan employee deductions. This one would also involve a couple of benefit plan design changes, because my objective would be to help make the consumer-driven health plan have a wider spread in terms of benefit and cost compared to the base plan. And so under this scenario, our current deductible under the consumer-driven health plan is $3,500. And so the way that plan works is the member is responsible for $3,500, and once you meet the out-of-pocket expense, then benefits are covered at 100%. But the plan can achieve the same tax favored status at a $3,200 deductible. So this would entail lowering the deductible to $3,200. That doesn't have a huge cost impact on the plan, but from the member side, it would be less out of pocket to them because of the benefit plan design change. And then a couple of other things here too. One would be increase the county's contribution to the health savings account to $1,200. That seems to be a good number to help trigger migration into the consumer-driven health plan. And I've got a comparison slide coming up on the next one to give you an idea of how that might work. And then I've also tagged a one-time $1 million infusion, which is basically a transfer from your general fund to the health fund to help get a head start on building your fund balance back, so that when we're having this discussion next year, we're not staring down large changes again. And so 15% increase on the county, no increased payroll reductions consumer driven, 5% on the base plan, improve the deductible by $200 on the consumer driven health plan, raise the health savings contribution to $1,200, and a one-time infusion of $1 million into the health fund. So even though that $1 million is going from your general fund to the health fund, it's still county money and it's still in county accounts. It's not like you gave it away, you're just moving it over into that account really for your budget purposes. There you can see impact on payroll reductions. There'd be none on the consumer-driven health plan. 5% was like that second scenario we showed earlier. So those are minimal changes on payroll deduction. And this version would have you on track to have your fund balance at 1.9 million, which is within good striking distance of where you'd want it to end up after we make whatever adjustments we might make in the next year. And so this slide here is one that I use personally when I'm making decisions, or even at Hub, when we have our open enrollment and we're changing up benefits and things, and people will come to our department and ask, you know, what should I do? Should I take this plan or should I take that one? And then I'll give them something like this to say, I'm not going to tell you what to do, but I can help you with some information so that you can pick your own decision. So in here, under the benefits, this is just showing you the deductible and the out-of-pocket amount. So there'd be an improvement on the consumer-driven health plan. Base plan would have no change in the benefits. No change in payroll deductions, 5% change in payroll deductions. So down here in the bottom, this kind of breaks out money that you'd be spending depending on what choice you pick. So the first category is contributions. This is the sum of money that employees would pay on an annual basis for their plan election for the full year. So there you can say, if I'm a single employee, pick the consumer-driven health plan, it's free, costs me nothing. If I pick the base plan, I'm going to spend $353 in a year. On the family side of the equation, that's a $2,000 annual spread, the cost of family coverage, consumer driven versus the basic. So this would be a category where I'd say, if you picked one of these two plans and you had no claims at all in the course of the year, this is what your decision is going to cost you. So now, maximum out of pocket, that's these numbers from up above. So up above, and these are all based on individuals here. So once I hit $3,200 in 2024, then I'm through spending money on my health plan. So my out-of-pocket worst case scenario is $3,200 here. Over under the base plan, it's $5,500. So already you can see things are starting to shape up. It's like, okay, if I pick the base plan, I'm saying two things. I want to spend $353, and in a worst case scenario, I'm prepared to spend $5,500. Versus over here, I'd spend nothing in $3,200. So far in the decision making, you can come to the easy conclusion. If I have no claims at all, which plan should I pick? Consumer driven health plan. It's cheaper. If I know that I have some catastrophic situations in my household, which plan should I pick? You're going to say, well, I'm going to reach this maximum here. The answer is consumer driven health plan. So for two categories of people, it should be an easy decision. The consumer driven health plan is the way to go. So then we add one more thing into the equation, that is the $1,200 from the health savings account would lower your total out-of-pocket cost under the consumer-driven health plan to what is shown down in this category here. So in an absolute worst-case scenario, I put no money in my health saving account and I have the most horrible year ever and survive it. I'm going to spend $2,000 after I burn through the county's $1,200. Over here, I'm going to spend $5,800. And then you can see how it plays out. So in a worst case scenario, this bottom right corner this is how much better off you would be if you were to have chosen the consumer driven health plan versus the base plan in a worst case scenario. And so there's good financial decisions on the way the plan's designed in terms of the benefits and the payroll deduction costs. But the majority of people don't have zero claims, nor do they have the worst year ever. They're somewhere in the middle. And so what you have to do is you have to be comfortable with your own decision. And we had this discussion with quite a few people at your health fair last year when they came by the table. And that's the most popular question that people ask us is, which plan should I choose? And understand that and you're looking at the top part of this grid over here, one of the deterrents to picking the consumer-driven health plan is people say, well, I guess, golly, if I was taking a high-cost drug and I had a hospital admission in the month of January, I'm going to spend $3,200. And the answer is, yeah, you probably are. As opposed to under the base plan, they would say, well, over here, I just have copays to see the doctor. I have a deductible that's lower, and then I owe some cost sharing if it gets high. The reality is, while that's a true statement, and to get in to see a doctor under the base plan over there, you would pay a copay, but under the consumer-driven health plan, you'd pay the full cost of the doctor office visit. Most primary care visits these days are running just over $100 per visit, and specialty care probably approaches $150 for specialty care on average for the cost of a visit. And so recognize too that there's some people in your population that would say, well, I don't have $100 to go see the doctor. I can come up with 35 or 40, but I don't have 100, and I don't have $1,400 to cover one script of Ozempic, but I do have a copay that I could pay over here under the base plan that I could do that. And I understand that. And that's where the increased contribution to the health savings account comes into play, because the way the health savings account would work is half of the $1,200 gets deposited in their account on January. And then in the month of July, for the remainder of the year, it comes in at another $100 per month. So right off the bat in the month of January, they've got $600 if they need to go and see a doctor or purchase a drug or whatever to help them on their way. And then when you come back and you look at this grid, if I were, in my conversations with some of your employees, they say, well, I'm on the base plan now and I like it. And then I'll tell them, well, what you just told me is you're okay spending $353 a year for your health insurance. And that's okay. If you want to spend it, I want to let you, but how about you spend it by putting it in your health savings account instead of just putting it in the bucket of money that pays claims for the county. So then if they were to do that, now they have $1,200 from the county and they have $353 from their own money. And they're just about halfway there almost to covering the cost of their deductible. And if you're looking at the same scenario with people that are in, that have spouse or child coverage, there's extra money that they're saying they would be willing to spend to have the base plan, where if they took that extra money that they're saying they would spend and they put it in the consumer-driven health plan, health savings account, then it becomes their money. And if they spend it, fine. And if they don't, it rolls over to the next year. So those are the things that I like about this combination, is that it does a few things. It helps widen the spread between the based and consumer-driven health plan. It lowers the deductible to the minimal amount that makes the plan work and still get its tax-favored treatment. The $1 million infusion from the county gives you a good jump start towards the next fiscal year, which would minimize claims. And then depending on how things worked out, if we were to go down this path, the cost of claims will change as people migrate from one plan to the other. And hopefully it would form the same patterns that we see with all of our other customers and lead to more favorable results long-term than the strategy of we like what we have and we just keep doing the same thing over and over and over. And that's the end of my presentation, and happy to answer any questions that you might have.
Okay, thank you. If there's any questions, if it's okay, I'd like to do it after the break,
Okay.
before we get into some support or control issues. So if that's all right, let's take a 10-minute break. Thank you.
Recording stopped.
Randy's presentation.
I have a question.
Recording in progress.
Thank you.
So on the hub concept, what is the total increase to the county? Actually on all these different proposals?
The county increase is what you're asking for?
Yeah, the county.
So he has that summarized in the recommended column under county. He has a change over current cell there on each of the plans. So for the first plan, it's 988,000. For the hub concept one, he has that change over current at 988,599.
But then there's also the $1 million infusion.
Right.
And then the $193,000 increase to the HSA for a grand total of 2.1 million. Would that be correct?
I think Randy's back on.
And, oh, go ahead, I'll let, is he?
Randy, can you hear us?
Randy, are you on? I think he's frozen.
I was just looking at like the 15% increase, and I was coming up with about 1.1
See his eyes blinking.
plus the million. I was gonna ask Randy, I'm assuming that the increase in the HSA, if that's something you chose to do, that's accommodated in those numbers. Because that's coming out of the health fund.
He's getting back on.
Okay. So, that 2.1 is what I was also looking at.
David, excuse me, Randy, can you hear us?
Yes, sir.
Okay. So, did you?
So we were talking about what the actual like dollar cost to our general fund, to our budget for next year would be, you know, for each of these plans, or to compare them in that way. And
Are you asking me for the comparison?
yes, so and then
Yes.
Anna was directing us to like the change over current on each page.
Okay.
And so in
Yeah, I would just need, so when I'm using the budget numbers, I'm only going by the figures that we have. And I can certainly pull those together for you. But your actual budgeted numbers may differ from mine. I'm just basing it on the enrollment in the health plan,
So
but they'll be very close.
So what the court was looking for was just the overall change in what the county contribution would be, including the change to the HSA contribution and the one-time infusion under the hub concept. So what's the closest, what numbers should they be looking at on the table, Randy, for that figure?
They're not on the table right now, but I can work those up for you and get them to you.
Okay. I had a
It would be, I can come up with a quick guess.
Just get them to us when he can. Fine.
Okay.
I guess
That would be
the main question is the $1 million contribution in the calculated in already, or is it, or is that in addition?
Oh,
Is that
the $1 million contribution in the chart on page 20. I'll
20.
Yeah.
put that back up there again, if you like. So yes, sir, the $1 million contribution is in that $1.9 million figure down below. So essentially, it would probably be this 2024 budget versus 2023 budget should be about a $1.25 million difference to the county.
plus on this page, plus the $1 million.
The $1 million would be included in that number.
And what was the total, 1 point what?
About 1.25. So
And
in
so-
looking
so-
at,
So you're saying that only about 0.25 is in addition to the 1 million one-time infusion? Am I saying that right?
let me make sure I'm saying it right too. The answer is, so let's see, in an annual basis, 985. Oh, I'm sorry, it'd be about 1.75.
Okay, so that's 0.75 more.
Other
And I get
questions?
that.
Yeah, I do. Back to page 20. Knowing that we're trying to incentivize the consumer-driven health plan, I understand that, but also recognizing that almost double the number of our employees are on the base employee plan. Could you run these numbers to where, and knowing that we don't have to reach that fund balance goal all in 1 year, Randy, as you've mentioned before, I'd like to see what it looks like with a 10% county increase, a 2% for both the consumer-driven and the base employee increase, and then everything else remaining the same that you mentioned on that page.
Okay. So 10%, 2 and 2 for consumer driven in the base, plus the other changes on there.
And everything else the same. And that's just,
Sure.
I would just like to see those numbers before I'm comfortable with making a final decision.
We have never changed, we've never increased the HSA contribution. Is that correct? It's always been the $1,200 a year.
600.
600.
$600 a year, excuse me.
Yes, sir.
$50 a month with it.
Yes.
But half of it's is deposited in January. So,
And
That's correct.
Randy, I'm gonna ask you to do this as well, and I know it's not gonna be the most popular idea out there. But how much can we, enhance the consumer-driven health plan? Because if you look at the numbers, it's the cheapest plan. If you're using it over, and you have claims, you're gonna end up paying less than you will. What if we looked at like a $2,000 contribution to the HSA? But at some point in time, we've got to consider making that the plan. I mean, I think he proved the point this morning in showing all the other entities that the consumer-driven health plan performs.
Yeah.
And it does, and so I think we have to look at it, is all I'm saying. I'm not gonna say right now that I'm 100% behind that this year, but if we're not at least looking at it, we're not doing justice to this.
So you're going with Honors deal of positive reinforcement?
Yes.
Okay.
Now, the HSA is only, the HSA is only attributable to the consumer-driven health plan, correct?
That's correct.
So it's already an incentive for them going from 600 to 1,200.
Correct.
Is it
Yes,
a
sir.
great incentive for a family with two or three old kiddos that every time they have to go to the doctor, they're paying $100 copay? Does that become such a great plan then, consumer-driven? For a family of, let's say, 5 that has 2 children or 3 children? I don't add very well, do I? And every time they go to the doctor's office, it costs them $100 per child?
I would say with an increase to the HSA on the other plan, it would be more considered for
Would
families
become
with,
closer.
it would be a consideration for them. Because then those $100
The little ones go to,
visits could be,
yeah, families
covered
with
by-
young children go quite often.
I have a question. I know we have a benefit, the flexible spending account used to be the cafeteria plan, where employees can commit to a lump amount coming out of their check that they have access to at the beginning of the new calendar year, how we do benefits, but they incrementally pay out of their payroll. Okay, that benefit cannot be applied if I'm on the HSA, or can it?
I don't think you can have.
I don't know. who
It's
can do that.
it's a little bit of a longer answer. So there's the flexible spending account, or referred to commonly as your cafeteria plan, and the health savings account. So they're very similar. There's FSA, HSA. Account is in both words. So the S is different. In the FSA, the S stands for spending. And the reason for that is that the FSA is a tax favored vehicle that the IRS created to allow you, an employee, to set money out of your paycheck on a pre-tax basis. It goes into your FSA account, and then you can use it for eligible expenses like your deductible and copay, et cetera. But if you don't use it all, you make your election for 1 year at a time. And if you don't use all the money you elected, you lose it and you sacrifice it. It goes back to the health, it goes back to the plan. Under the HSA, the S stands for savings account. And the key difference between FSA and HSA is that so for example, if I put $2,500 in the FSA and I only use 2,000 of it, I sacrifice 500. If I put the same 2,500 in my health savings account and I don't use all of it, I just spend 2,000. The $500 that's left over stays in my HSA and it rolls over to future years. So the expenses that are eligible to be reimbursed by either account are exactly the same. So anything I can claim a reimbursement on FSA, I can claim a reimbursement on HSA. So I'd like to describe the HSA as an FSA on steroids. So because everything you can do under the FSA, you can do with the HSA, and your money can roll over from year to year to year. Plus, you can put more money into the HSA than you can do on the FSA. One advantage the FSA has is really an advantage for people that want to game the system. And that would be that the FSA is not a bank account, it's just a benefit account. And so if I were to pledge $2,500 for the year, and on the first day of January I had a $2,500 expense, I can claim my $2,500 out of the account, even though I've put no money into it. On the HSA, you can only spend the money that's in the account. So some sophisticated people working the system would say, well, I want the HSA or FSA because I'm not planning on working all year. I want to ding the county for $2,500, then I'm going to quit and walk away. And I walked away with your $2,500. That's really the only material difference between the FSA and the HSA. The HSA, your money's in there, can also be used to pay for your Medicare Part B premiums when you retire. It could also be used to pay for COBRA premiums if you were to terminate early. And it can also be used to pay for qualified long-term care plans out of that amount. And inside of the HSA, once you get to a minimum base threshold, usually $3,000, if you have more than $3,000, you can take your money in the HSA and you can invest it in the market. Usually most people might pick some mutual funds. And if the money grows, the capital gains growth inside of the HSA is non-taxable. And if you take the money out on a qualified expense basis, it's also non-taxable. So the HSA has 3 tax advantages. The $1,200 from the county is non-taxable income to the employee when it goes in the plan. Money that the employees might want to put in, perhaps from payroll deduction savings, gets taken out of their check pre-tax just like the FSA, and it goes in non-taxable. And then the money inside the plan, if it's invested and it grows, the growth is non-taxable. And then when the money comes out of the plan for a qualified expense, it's non-taxable. So there's no other deferred compensation type of concept where it's non-taxable every step of the way. So there's usually you either pay with pre-tax monies and your withdrawals are taxable, or you pay in with post-tax monies and your withdrawals are non-taxable. But the HSA is the only one that covers all the bases for eligible expense. But if let's say you have money in the HSA and you want to buy a boat,
Okay,
that's not going to be
wait.
qualified.
Randy,
Yeah.
I want to bring you back. Let's get back focused on health benefits.
Okay.
Because the direction that I'm trying to clear in my mind is the employee having money when they go to the doctor. And so with the health savings account, an employee is able to go and pay that expense up front. With the health savings account, they have that, right now they have what, the $600 that's in there at the beginning of the health calendar year? Okay, so am I going to pay, when I go pay, am I paying the copay or am I paying the total service when I go to the doctor under the HSA?
Under the
I'm
HSA,
paying
you would
it.
pay the total cost of the charge.
Okay, so I guess what I was trying to focus on, but I do thank you for all of that auxiliary information, which might be good in an email, so I can keep up with it. But I'm trying to focus on the expense to an employee up front, because that's what why a lot of employees go with the base plan, is the apprehension of having to pay up to $3,200 before any benefits kick in. So how do we put money in their hand to take some of that anxiety off? And so I know it's what we're banking for them at the beginning of the health benefit calendar year, the 600. So I do like the increase to 1,200. But Commissioner Smith does raise a good premise when he says it's not going to take a lot of visits to eat into that 1,200 if there are if you have multiple children in your family. And so I'm looking through the lens of a single parent, which they kind of share the brunt of costs just by situation. And so that's where that flexible spending account helps, because they get a lump of money at the beginning of the calendar year that they can start using for co-pays and things like that, and deductibles. And so I'm trying to see which is the best, because I know a lot of things we did also, although we did not increase their premiums, we made some modifications to our plan benefits. And so there are some out-of-pocket expenses in addition to their premium that employees do pay. So, and that's why I'm a little shy on the increasing, like the 5% that they might have to pay in light of with that Eat the Cola that we're gonna give them. So I know, I'm just trying to get a lot of information to make the best decision. And so that's why I was asking you about the flexible spending. How can we get money in their hands as they go into that benefit calendar year and they're looking at having to pay deductibles, co-pays and premiums, et cetera?
Sure. So with the HSA, you could put, I mean, so if you were going to pledge $1,200 from the county side, and even the $600, I mean, you could put it all in the account right up front at the first of the year. So if you wanted to, if you were going to approve an HSA contribution of $1,200 annually, you could say on January 1, I'm going to put $1,200 in your account. And so once the money from the county goes into the account, then it immediately vests to the employee. And so one of the reasons employers don't put all the money in up front, some of them do though, the city of El Paso puts all the money in at the very first of the year, would be that if I, you know, if it was me working there, and again, I'm there on the first day of the year, you contribute $1,200 into the account and I quit on the second day, I walk away with your full $1,200. So that would be the downside of front loading more money into the account up front, but some employers do that. And so that would be, you know, one way to put it in. I had one employer one time wanted to create a 100% benefit plan. So he bought a high deductible plan and then fully funded the HSA so that it was free to the employee. Then he had a lot of people leave and walk away with his money, and he said, "I'm not doing that again."
Did he get
But,
reelected?
no, he was private sector.
No.
But but he still has a job. He still has a good company.
Oh.
But he doesn't front load it like that. But if you were going to go, for example, to the $2,000 contribution, then you could say, well, I'll put 1,200 in up front, and the other 800 I'll trickle in, you know, however you want to do it. So the rules on the county putting money into the plan are just that it can't be discriminatory. So you can't say there's one rule for commissioners and a different rule for detention officers. Everybody has to follow the same rule. So whatever rule you make, you just apply it across the board, but you could put it all in up front. You could put it all in at the end. You could put it in quarterly, monthly, any combination of the above. And same thing for employees. So let's say that, you know, they thought, I'm only going to have this much money in the year, and then they get their tax return and it's more money than they thought coming back. At any time during the course of the year, they can take money of their own and put it into the HSA and beef that up. And then if it doesn't come out of the payroll deduction, you didn't get the pre-tax benefit, but when you file your income tax, you get your deduction at that time. So there's a way to get the money in, and both accounts would also have they do have debit cards. So when the money's in the account, you can use your debit card to pay for it, whether it's the flexible spending account or the health savings account.
And the other, Commissioner, also, there's a $200 a month difference for employee and family. And that should just roll right into your HSA. So you get your $1,200 coming in, and then you're saving $200 a month by being on the consumer-driven plan. That 200 you ought to just be putting it in your HSA.
That was my question on clarification. Can an individual add to an HSA?
Yes.
Okay,
Oh, yes, yes.
okay,
Yes.
okay,
There's a
Yeah,
maximum
the-
you can put in there, but
okay.
And for the flexible spending account, not only
You
is
lose
the
it.
base plan more expensive, but that's the employee's contribution. There's no county contribution
Well,
going into
if the
flexible
employee
spending.
adds to that, say $1,200, at the end of the year, if they didn't spend it, does their contribution also roll over under the
Right.
HSA?
For the HSA, correct.
Okay.
You can end up
Yes,
with
sir.
quite a balance in your
Yeah,
HSA.
you could if you would, yeah. The only thing I'd say to remember is we're talking about individuals here, because when you get to like a family plan, under the base, it's what, $4,000 deductible under a family plan, and the consumer-driven is like $7,000, I believe, for the out-of-pocket.
Yeah.
Correct.
Isn't that correct? So it's
Yes, sir.
a considerable amount of money.
But so can the 20% you're gonna keep paying on the base plan. Because you're having to pick up 20% of the costs.
I think it's a roll of the dice.
I have one more thing. I just want to clear up. I know we keep coming back to this, but Randy, so on page 20, that one concept that's shown there, and when it references the 15% county increase, so I know you can look at this different ways. What we have always done here at the county is we have pushed currently it's $6,757. We push that per position into the health fund to keep that afloat. So if we took that times our 1,100 employees, we're pushing about 7.4 million into the fund. And so are you saying we would tag on 15% onto that amount that we're pushing over per employee, correct?
If you are budgeting on all 1,100 employees, then
do.
that would be correct. I didn't, so my numbers are based on, your budget is based on employees that are enrolled in the plan.
Okay,
But I don't know, I don't believe that's 1,100 employees enrolled in the plan right now.
There's only about 800 or 900, aren't there?
yes.
Correct.
We've always pushed money for every position, just not knowing, when positions will be filled during the year. you know, and just also, of course, maintaining that fund balance, in the health fund.
Okay, so that,
So maybe the
that,
way we do it, I'm sorry.
I was gonna say, that could be a material difference between my figures and yours. That's what I was saying earlier, you know, to give you a number on the budgeted, you know, the budget impact, I'm working off of the people enrolled in the plan. But if you are budgeting for positions that aren't filled or for positions that don't elect the plan, I don't have a number to take and capture that and incorporate it in our forecast.
And so the way you've done it based on who's enrolled, that 988,000, that's the number you're saying that perfect world, that would be that 15% increase? The change?
Yes,
over
based
current-
just on the people in the plan, yeah.
Okay, okay.
But if you've got 300 people that you're budgeting for that aren't in the plan, then that means you have more money in your budget than I'm seeing on my forecast.
Can y'all just get together then on your numbers?
Sure.
Make them correct
It could be material is the,
in the decision, yeah. Got 300 employees difference.
But that's where, you know, it's impossible to know as you're going month to month, who's on what plan, and so that's been done from the onset of our self-insured plan. But it has, that extra money, I think, has helped our plan track along.
Yeah.
Because you're looking at a lump sum in the end.
Randy's numbers may be, his projections may be different though, based on what we do have in the plan.
When I'm looking,
Yeah.
was Randy getting ready to say something?
I was just going to say, yes, that would be a difference if that's the way it was.
Could actually be a difference in shortfall, could affect. the
Correct. On my side would be
projection
shorter
of
than
shortfall.
yours. But yeah, I can definitely get with Jessica and make sure we're working from the same page.
I'm looking at the current enrollment breakdown. And when I look at the high deductible plan, it's showing like 56 employee and children. And the base plan is showing 136. The other plan, the other numbers are pretty close. Employee and family, employee and spouse. Then there's a little gap when you talk about employee only. But I think with, I'm kind of focused in on employee and children. And I'm looking at the fact that, are we seeing employees who really want to be able to calculate what their expense will be? I know from my, hypothetically, I would know from my plan benefit sheet what it's going to take if I have to take my children to the doctor, no matter what happens. It's a little different with children as opposed to employee only, because, you know, if it's just me, you know, I'll stay away from the doctor as long as I feel like I can stay away
You
from
might
the
write
doctor.
it out.
Yeah, but I'm going to take my children, and you never know when they're going to wake up and be sick. And so what I'm a little squeamish about is taking the choice away from parents of being able to budget, to being able to calculate how much is going to come out of their budget, especially employees that we have perhaps under the 50,000 annual salaries. And so that's why the high deductible plan, I'm a little apprehensive of it because I have to have $3,200. However I put it together, I've got to have $3,200, and I can't count on the flexible spending balance that maybe I do with my base plan. Because if I'm on a base plan, I can do the flexible spending. I can commit to $1,500, $2,000 a year. I can pay it out. So, but I know it's sitting there on my United Health card if something happens in the middle of the night and I have to take somebody to the doctor. So I think it's the comfort of what health insurance is supposed to give to our employees, and that's knowing I'm gonna be okay if somebody gets sick. I'm gonna be okay if I get sick, as opposed to if one of us gets sick, I don't know what that amount is gonna do to my budget. That's what throws me off with the
I-
health savings.
I think with the consumer-driven plan, one doctor's visit, if you have multiple kids, could throw off a monthly budget, a household budget. When you don't know what the expense is going to be at the doctor's office. And as the HSA currently exists, an employee gets $300 in January to be able to pay for things like that. So as it exists now, the plan design, definitely that it's a hesitation for our folks, especially the group you mentioned that make under $50,000. It's a hard ask for those with kids to expect to make possible urgent care visits for kiddos who are sick with $300 only at the beginning of the year. But I think an adjustment to the HSA upwards of $1,200 or $2,000 and break it up in the same way it is now, where an employee might get $600 or $1,000 in January, would bring some level of comfort, like you mentioned, that they get from having co-pays. I think some of that comfort may transfer to the high deductible plan if they have that $600 or $1,000 in that piggy bank that we've set up for them. That's purely county money. It's none of their money that they would have access to. In addition to HR and HUB making recommendations to them at the Wellness Expo saying, this $200 you're now saving a month in premium, pretend like it's not there and put it in your HSA rainy day fund. That's that might be a hard sell, but I mean, it's an education that both parties can provide.
Well, and I agree with you. I don't think it's necessarily that hard to sell because it's for your benefit. You've got a $2,000 deductible anyway. If we put $1,200 in, there's your $3,200
You
deductible
already have it.
right there.
Right.
And so it's just changing a mindset is what it is. But we do have to make the HSA more enticing. There is no doubt about that. But getting them there is more of a mindset change because now you've got your $1,200, you don't have your $2,000 deductible that you had over there. You add those two together, it's still $3,200. So it's what pocket you want to get it out of.
Yeah, pay me now, pay me later.
Yeah, and by continuing, even on the illustration on page 20, the change in child coverage under the base plan would be $14 per month. In a scenario that was just described, if we lowered that impact down to 2%, then that's essentially no change to the benefits or very little change to payroll deductions. So single-parent households with kids would still have a viable option under the base plan.
Are there other scenarios that y'all would want Randy to run? I want to try to end up this discussion if we can. And, we can also call him back and ask you questions or text him, email him as well. But anything else y'all can think of?
I think y'all wanted did y'all want him to run the 2,000 in addition to the 1,200?
I have that in my notes.
Okay, Randy?
The hub concept with a $2,000 HSA contribution from the county,
will-
and then your.
And I would like to see the 2,000 less the $1 million infusion.
Okay. Anything else? Okay.
That includes the 5% base employee increase, or we just doing like a 15% county increase with a $1 million infusion and then a 2,000 health savings account contribution?
So I have a hub concept with the 15% county increase, 5% base employee increase. Did you want to see something else?
I asked
Yeah, I
him to
wanted
do the 10% and 2 and 2.
Okay.
I wanted the 15 and no employee increase with the $1 million infusion and the HSA contribution at 2,000.
Okay. Anything else? All right, do y'all want, we're gonna recess for lunch. Do y'all want to come back at 1:15? What do you, what's pleasure? What do y'all think? 1 o'clock, all right?
We posted for 1:30.
Pardon me?
Posted it for 1:30.
Oh, we posted for 1:30?
Does that matter? Where's Reagan?
Yeah. we
1:30, we're
it.
posted at 1:30.
We can't start before then. All
Oh,
right.
wait, no, that's Wednesday. Wait, we're not posted.
Oh,
That's Wednesday.
Oh,
my bad.
Yeah, we should be able to set whatever time
Okay.
for this
Alright.
afternoon.
Okay, 1 o'clock, all right, everybody?
Okay.
All right, that's recess until 1 o'clock. Thank you. Oh, thank you, Anna, for spending your birthday with us today.
Oh, wow.
Happy birthday.
All right, we'll recess till 1. right, let's call court back in session. Okay, we have more discussion on the health plan.
I do not.
Okay, any follow-up questions anyone have? Good,
I think it's,
tired of talking about it.
I think it's gonna take some, study,
Yeah,
and quite a bit of thought. I don't think, we still need some numbers from Randy.
right. And so Anna's taking notes on, what additional information we had, and of course Randy was on as well, so I'm sure we'll get those numbers and just share them, go ahead and share them directly with the commissioners at that time. All right. Francis?
So then continuing with personnel, I think we're up to the point to go through the request for increases or changes or new positions.
Yes.
So,
That's right. I can share my screen again, and like Francis said, we're at that, that second part or piece of what HR can provide for information.
Okay.
That's where it should. So that's reviewing each individual department or individual personnel request and breaking out groups of our workforce piece by piece that the court has an interest in. So we'll be reviewing in this section our county leadership positions, so department heads and elected official salaries, and then also we have a special pay supplement request from the sheriff's office in the form of certificate pay. We'll be reviewing that, as well as two large departments have new leadership, and they have formulated a plan for how they would like to structure their offices. So that's our information technology and district attorney offices. We'll be reviewing those requests. And also, I touched on this a bit last year. I went ahead and included this information as a part of the presentation, and that's a review of work volume for those offices who do report to an outside entity, such as our courts, our law enforcement, and offering that review and information to the court for consideration. And then, again, that kind of line by line, if the court wishes, review of each personnel request. So that's what we got for the remainder of the presentation. So up first, we have a classification review of department heads and our county administrator position. So there's been some question on the relevance of our current pay grades for department heads and county administrator, the specific positions. And so when that was presented to HR for question, we just thought it would be best to do an overall group review of classifications for these positions, because just historically, it seems like they've been individually assessed as they are vacated and then posted, but an actual group-wide review of classifications, from what I can see in our current HR archives, doesn't seem to have been completed, and so that's what we've done. Just some information on how this was completed. So we actually looped in our county administrator to help with this, so we had somebody outside of HR doing an assessment for each of this position, so it wouldn't just be one department reviewing the classification and the functions of each of the positions, to try to be as fair and accurate as possible. And so HR shared the Waters assessment, which we use to determine classifications. We shared that with our county administrator, shared that template, and he himself applied the template. And so although we have a review completed for both my HR director role and the county administrator, neither of us completed an assessment for our respective positions. That makes sense, just for fairness. Our reviews of classifications under HR. They're always done by two individuals. That's myself and one of our HR generalists, Holly Berger. And so it would have been a 3-person assessment to be sure we're not missing anything or skewing anything. This is in the red column here. There were changes after the 3 of us came together and kind of came to an agreement on these pay grade classifications and reviews. There were changes. Only 3 of these leadership positions saw no change, and the rest of them saw changes, whether it be a pay grade up or a pay grade down. There were no changes more than 1 pay grade. So that's here for your review. Even with the changes to the pay grades, you can see that the resulting compensation ratio average is still within that 0.8 to 1.2 range. And so if the court deems it appropriate, we can make this recommendation to go ahead and update the classifications of these department heads and county administrator positions. I do want to highlight the lowest individual compensation ratio that kind of resulted from this review, and that would be the county administrator position. You can see the market average. I have an asterisk by that. And so in the Texas workforce labor market information, there's not a clean comparison in job functions for the county administrator. So that's often gone without comparison or a comparison title. But when reviewing job functions and descriptions for assistant city managers, they're very much in line with the description for our county administrator. So using local municipality information from Hewitt, Woodway, and the city of Waco, which are the only municipalities that have an assistant city manager role, we plugged in those salary averages as that market information there. And so that's what you're seeing there for the county administrator line item under market average, and that brings the market compensation ratio to a 0.85, which is getting closer to that bottom of the range of 0.8. So we just want to flag that as that. If anything needs adjustment, that would be our first recommendation there. There were other municipalities in our local area that we researched to see if there were other comparisons. The others didn't have an assistant city manager role like Bellmead. They just have a city manager.
And you're saying assistant city manager.
Correct.
So the county administrator is like a city manager.
When reviewing the functions of the position, the descriptions of the assistant city manager, they seemed in line with our county administrator description. And so that salary that you're seeing there for market average of $151,000, that would be the average of assistant city manager. We would not have factored in the city manager salaries.
Okay. All right.
You have no market average or market comp ratio for the elections administrator.
Right.
I mean, why?
That was very difficult to pull from any private employer. Or
Would we not pull him from
public
other
em-
counties?
Yes, that's what the county comparison is. So we do
No,
have,
other counties. Because I know there's a majority of our counties operate their elections under an elections administrator.
Mm-hmm.
So for that position, would we not compare him to other
There is.
it's there.
elections
So-
there is no market, the market average.
Yes, ma'am. Sorry.
Okay.
The market average, and then we have the county comparison. And so all the counties who do have that elections administrator title, that's what we pulled in there.
Oh, okay, I thought that was our internal county.
Mm-hmm.
Because aren't those other averages, okay, I guess then define for me our column topics. So the county comp average and the county comp ratio is not within McLennan County. Those are our peer counties?
Those are our county counterparts, right, our peer counties.
Okay,
Those are just the peer counties.
Yes,
Not all counties in the state.
correct.
So So that goes back to that same page that you had previously of those counties?
Yes, sir.
Okay.
That's exactly right.
And do all the peers have the election administrator?
I don't know that off the top of my head,
Some
just
counties
because I
don't.
know they
Right.
house them
That was my-
sometimes
that's
under
my
the county
question.
clerk's office,
I
but
would
I can,
assume the smaller the county size, the
Less likely.
they might house it under the county clerk's office,
Mhm.
and I can identify those for you and look back and see which ones specifically had them.
That you used to come up with this? Okay. I have a question again on the health director and the elections administrator. Because both of those functions pretty much operate strictly out of statute, whatever statute says. And with the number of staff persons that she supervises, how is it that, or are you bringing him up to her grade?
Right, I'm glad you point that out,
Okay.
because that's a very good observation when looking at their pay grades. They both operate very closely out of statute, and so it would make sense that they be in the same pay grade, and that's
Okay.
what's happening here. So this elections administrator position is currently an A32. The recommendation now is that it be an A33, which is the current pay grade of our health services director. So
Okay.
they would then be both A33s.
Then why is there such a disparity with their budgeted salaries?
That, I believe there's some history behind there related to the previous elections administrator, but I don't know the full detail of how that came to be. I just know that budget is more closely related to the person who was previously in the role rather than the function of the role itself.
Okay. I do remember how the salary was established behind personality, but I do know we've also spent several fiscal cycles trying to get those salaries more in line with their function and their pay grade. So at this point in time, based on everything we've done, why are those salaries still so far? Are we saying the elections administrator salary is still too high for where it's supposed to be? Or is it that we need to bring the health services director up?
That would really be,
Just based on functionality?
based on
And pay
functionality, they
grade.
should be closer together. And that's why you can see the comp ratio average, which is the last column. This elections administrator position is one of the higher comp ratios. So your observation there again is spot on. It's may not necessarily be where it needs to be when compared to its peers.
Okay.
Do we have any other questions? There aren't any specific submitted requests, personnel requests for this. This is at this point just information for the court, and if the court would like to move on the recommendation to update these pay grades, that's something that we can communicate to Francis and have that included for.
I would be fine with, court considering, the pay grade upgrades or, and then as we go through this process, we will talk about any salary adjustments.
Okay.
I'll take them two parts. Any other thoughts on that? Does that sound all right?
Okay. Yeah, I concur.
Great.
Sound all right?
Yes.
Great.
All right.
So up next in our leadership review, we have the compensation review for elected and appointed officials. So here what we have, because there aren't a lot of, like with the elections administrator, there's not a lot of private sector or market comparisons available. And so here the only benchmark you're gonna see is the county comparison average, which are our peer counties and what they pay each of these respective elected officials or appointed officials. And then the resulting compensation ratio. What I've done is just organize them from smallest ratio to the greatest ratio. just to see what needs to be addressed, if anything at all, or what HR would recommend be addressed. And so I've highlighted the lowest ones, and so those consist of our constables and just a couple of our JP positions. And so right now, and this, we could definitely put a placeholder, a pin here, but for the time being, HR is just putting forward a recommendation to bring the positions to a minimum of 0.8 compensation ratio, to bring them within that recommended ratio range, with the exception of the constable for precinct 2. So there's a difference there between this constable and then the other 3 constables, and that would be because this person oversees multiple deputies, including 1 supervisor deputy. And so we feel like that does warrant the difference in pay, so we want to keep that differential there between the other 3 constables and this specific precinct 2 constable. So we would recommend maintaining that differential, so that's why you'll see a 0.84 there for the resulting compensation ratio. We're currently working on, it's in progress, an alternative solution to how to address salaries for these specific positions, but it's still in a draft mode, if you can say. So once that's ready and actually has more review, we can present that forward to the court.
Speak up a little bit.
Once that's ready, we can bring that to the court.
Okay. All right,
Any questions here?
any questions?
On all of this page, or just the constables? Which are we talking about?
Either.
What type of adjustment were made or have been made regarding, okay, I'm looking at JPs right here. I know we have a newly elected JP who took office at midterm, or when, and took the salary of the previous JP who was an attorney.
Yes, sir.
So what type of adjustments have you made for that situation to where that JP with that attorney degree did a lot of attorney work for us?
Right, so that would be JP5, and that current budget is $75,098. And you can see my recommendation is to bring them to a 0.8, which is actually a decrease. So it would bring them to 71,000. So pay cut of almost $4,000 to bring them in line with JP4 and 2. So
With
that's-
JP4, I see what you're saying. JP2, let's see, I'm trying to read across. JP2, JP,
So you're bringing up JP4 and 2 and bringing down JP5.
Right, so that they all have the same,
They all have the same.
5,
right.
2, and 4 are all the same now.
Which is just one way to handle that position and that specific issue that Commissioner Smith has brought up, because HR is aware of that. And so this is one approach that can be taken.
4th, 2, and 5. Okay, so the highlighted areas are the changes, are the recommended changes.
Yes, sir.
From Constable through JP.
So are you calling this, for lack of a better term, like a base salary? Say, for instance, a new JP comes into 2, 4, or 5, and they are an attorney. How do we navigate those special circumstances so that we don't find ourselves here again?
There are special circumstances like qualifications, for instance, or even functions that each individual JP may take on and others not take on. And so those are factors that we're trying to compile into this alternative solution that HR has in progress. And so once that is better ironed out, we can present that to the court for review so that there is a plan and how to address each of those different factors, whether it be education, qualification, or the functions that they've volunteered to do.
Okay, so this modification won't handicap any of these positions?
That would be the goal, is that right? It wouldn't.
Okay.
Commissioner, and of course, the only way you can be sure it didn't happen again is that none of these resign in the middle of their term, because when we appoint, they have to take the salary that,
That was an election, right?
well, Judge Villarreal.
Yeah, it
let's
was an
see.
election. He retired, it was an election.
Okay, so what, Dustin, what was, not specifically the statute number, but just the general?
So Judge, it just has to do, when we set the elected official salary as part of the proposed budget,
Right.
and that's when the salaries have to be posted. You go through the salary grievance process. And so when that salary is posted, in order to change it, you have to restart that whole process. And so with Judge Miramontes taking office on January 1st, she took Judge Villarreal's salary.
That's right. And but so there couldn't be an adjustment
Right.
before his term was out, so this is the first opportunity to adjust it, and so to do that, we had to take in consideration what he came to the office with and what she came to
Right.
the office with. Which he was an attorney, he could do blood draws, he was also very active in pretty much all phases of that, so. Okay. All right.
Okay. If we don't have any other questions here about our officials, we can go to the next item.
Okay.
And so those other slides are related to, groups of the workforce. This next piece of information I want to present is related to an actual personnel request we have submitted from the sheriff's office, and they're requesting and proposing certificate pay for their law enforcement positions. So that would be their deputy positions and their jail staff as well. So their licensed positions in both jailers and deputies have levels or tiers to their licensing. So there's a basic, advanced, and master level for these licenses. And their proposal is to pay the employees for whatever certificate level that they reach. And this is one of these instances where if we want specific dollar values of what a program like this would be like, we can pivot to one of the auditor's spreadsheets to get that total effect on the budget. And real quick, what I have here is just for information for the court to consider is a comparison of what other counties are doing respective to certificate pay. And so we do have many of our counterpart counties offering certificate pay. We haven't gotten a clear answer from those 3 counties at the bottom, Webb, Smith, and Brazos, but the remaining counties, Bell, Brazoria, Galveston, Hayes, and Jefferson. So they do offer a step pay. However, 3 of them don't have step pay. And so HR's information to consider would just be, we have step pay, and some of these other comparison employers do not have that. Also, something else to consider when reviewing certificate pay is tenure is actually one of the factors in qualifying for a particular license level. So is there a minor overlap or duplication of our step pay program? And another point that HR would want to be sure we iron out, and this we can actually do in partnership with the sheriff's office, is if it's something that the court wants to consider budget-wise, we would want to build out an actual policy for eligibility for certificate pay and training for the certificate pay, and how that would be rolled out and implemented for that workforce.
And what was your statement about certification pay and was it longevity pay or year, or what, you said it in, I missed, I guess, understanding what you said.
So, and that, it's just that years of service.
Years of service.
Is an actual, it's one of the factors in qualifying for a particular level of the license.
Okay.
So in order to qualify for a higher license, there's a minimum years of service before you're eligible for it. In addition to training hours, also education is a factor into the level of the licensing that you qualify for. So my question would be, do we need to look at whether or not there's an overlap of these programs or a duplication of some sort with the
So
programs?
from basic to intermediate, you have to have been in basic for so many years to get to intermediate.
Right,
Okay.
that's correct.
Okay.
And each license is different. I don't have the examples here, but David shared that it's all available through TCOL's website. There are these just PDFs available to the public, so if the court wants to see those, we can. But those are the items I would consider is what our county counterparts are doing, what we're doing with step pay, and the actual qualifications for each licensing, and then building out an actual policy around certificate pay to ensure it's being administered equitably amongst the workforce. Those would be our points to the court for consideration. Would you like to see kind of what that budget amount is for certificate pay?
Yeah, please.
Let me stop
I have a
sharing.
question. Are there exams required on these certificates? Like, or is it just training hours?
Completion of course or something like that.
It's course complete.
David, you want to come
David?
up?
Yes, that's correct. Every course comes with an exam that has to be taken to ensure that the employee or trainee has retained an amount of information that the state has deemed necessary for course completion to be considered.
Did you pick that up?
What did you just say?
Yeah, they're gonna need you to come
He
so he can
picked-
pick it up.
Come up here, David.
You need to come to the mic.
Yeah, I think they're not hearing you.
I think we picked it up. Yeah, we did.
So all of the courses that are required for this, which are some pretty important ones, you have mental health-related crisis intervention, de-escalation, racial profiling, things like that that are associated with some of these certificate advancements. All of those courses require a test at the end that the student must show a proficiency in for minimum retention of information before they will be considered to have completed that course. Also, in regards to the term of stepping on the step pay with years of service through the TCOL proficiency licensure can be offset by training hours. So as the number of training hours goes up, the requirement for years of service goes down, such as with basic to intermediate. That can go all the way down to a 2-year period of time if you have X lump of clumping hours and then 18 specific courses that the state requires for that proficiency to be achieved.
Okay. So length of time is offset by training hours.
To some
Can
degree,
be.
no less than 2 years, though.
But must have a minimum of 2 years to go from basic to intermediate.
Correct. And then
Well-
advanced is
Is it master or advanced? What's it?
correct. You go from, there are policemen that have not even a basic certificate, right? There are requirements to even receive basic. You still have a peace officer's license, but you do not have a basic proficiency license. So once you've reached that basic proficiency license, basic to intermediate, intermediate to advanced, advanced to masters, the only disparity is that the progression from advanced to masters requires nothing but time and service or an extremely large lump of training hours that will offset that cumulatively.
Other questions?
Well, I would like to look at it as a possibility, if nothing else, for retention purposes. If it's a if it's a plus to retaining personnel, then I think it's something to consider.
I think that's the main point, right?
Yep. Well, and if I could address the court on that.
Yeah, sure.
It is certainly part of it, but just to give you a small sample of what it actually is for the department, it's for the individual progression of the employee.
Right.
And making sure that they have these non-mandated yet very important skill sets such as crime scene investigation, child abuse prevention, arrest, search and seizure, Spanish, so making sure that our guys have some way to communicate with the Hispanic population in the community, identity theft, asset forfeiture, racial profiling, human trafficking, crisis intervention, dealing with deaf and impaired drivers, de-escalation, and the list goes on and on. So those are very important courses, none of which are mandated for licensure.
Well, I would think to offset some of the liability, one of your hold harmless is to be able to show, hey, this officer, this law enforcement officer has completed this course. And that's always a way to shield you from liability.
Sure.
And so the more people that have that,
Absolutely,
the less
Commissioner.
liable they and the county.
It also helps us expand the scope of services that we're able to offer the community as the basic licensure or non-proficiency certificate TCO certified officers are required to a base minimum standard. And does our community find some of those things I've mentioned to be things that are worth investing in? And if they're worth investing in as the community, then that's y'all's decision to fund that.
On our basic or what it's called, do we require our people to, within so many years, to advance to another level or to have a certain hours? I know they all have to have the 40 hours in a training cycle, but is there some department policy that says you must move toward the next level or?
No, there is currently not one. Now, there are divisions that try to artificially push their people to receive the intermediate, advanced master proficiency certificates. And certainly those are things that department managers will look at in regards to the promotional process from time to time. But trying to get the problem with using that for a tool to determine who's going to be promoted is now you're left with a proletariat workforce that doesn't have the de-escalation, racial profiling, so those people go away. They're no longer on the streets doing the things that those trainings were
Need
meant
to
to
be done.
provide in the first place, yeah.
Okay.
As far as you know, there's not any grants out there to help offset some of this, or is there?
We have looked into it, and our grant coordinator has looked into it. We can find nothing that would apply to this directly. And that amount, just to let the court know, that is a snapshot. So we had to go through and manually pull, 500 PSR records to get that information. So it is only good as of the day we pulled it. But the implementation, if the court so chooses to do so, would be similar to how the STEP program is done. The officer is required to notify us of advancement. It is their license, not the department's license. And then we would recommend that those are turned in by a cutoff date of something available for the budget. Submitted in the budget, this is how much it's gonna be next year for cert pay. That way you'll know exactly what it's gonna cost you in the next year, and you have the levity to approve or deny any of it.
Okay.
So this
This
budget,
time, go ahead.
this budget is for those currently licensed.
Correct.
And not accounting for any.
Day one, yeah.
Right.
But
And so that's my question. The individuals on this spreadsheet, they paid for their certifications? How did they get time off? Did they do this on their own? Because they paid for it on their own. So did they do this on their own?
So police officers are required to have so many training hours per cycle. There are a specific number of courses that are required by title and some that are required just in general training. Some officers will choose over a period of years to engage in these courses to knock them off their intermediate list for progression over the years. But that is a process that can take the average employee that's receiving 40 hours worth of training as a TCOL mandated standard every 2 years, up to 6 or 7 years just to make the initial jump to intermediate, and that is trucking it for the standard 40-year, 2-year, or 40-hour, 2-year rollover.
And the reason I asked you that question, because I commend these officers, and I saw that list of courses when I met with you and the department, and I could see how it is very beneficial for a law enforcement agency to have officers that are taking those courses as they are listed. And we talked about the fact that, knock on wood, McLennan County has not seen some of the tragic incidences that have happened across the country. And I do think it's tied to the level of professionalism and training that our officers have. I just feel that plays a part in it. And so that's why I wanted to know, right now, we have these many officers that have been working on this type of program, and they've done it out of their pocket, and they've done it on their own time, and I just think they need to be commended.
Or they've chosen to make that
Mhm.
decision
That investment.
for their own personal career, just for
Right.
their own service to the community. Sure.
I know I've seen them come off 8-hour, 10-hour, 12-hour shifts and go straight into training after they,
8-hour
after
course.
they completed their 12 hours and sit there for another 8 hours before they have to go back on again.
It
Lot of
certainly
dedication.
is less than ideal, but it does happen.
Yes, I've seen it.
Other questions? Thank you, David.
Thank y'all.
Okay. So we've reviewed that possible pay program. I think now I'd like to just review the larger, what's making up kind of a larger proportion of the personnel requests this budget, and those are those two large offices under new leadership this year. And so that would be first our IT department, and then our district attorney's office. So first, for the information technology department, I have here a proposed department structure that the IT director would like to implement. And so the primary difference between the current structure and this proposed structure is the addition of a project management office. The project management office would, what it sounds like, really run and coordinate all the projects that the county is currently experiencing in its technology. And that would include 2 additional positions, a new senior project manager and a new audiovisual technician. That audiovisual technician was something that was considered last year by Commissioners Court with the addition of the existing project manager position. But through those discussions, the Commissioners Court thought it would be best to wait on this position. The current IT director does think that is a need that the county has. The other 2 divisions of the IT department, infrastructure and then currently desktop, but proposed to be called IT support. Those structures are already in place, and so this additional division really is the big difference for the department. The county as a whole is experiencing an increase in projects, and IT-related projects that are occurring simultaneously. And when I say the word project, that can really mean anything to anyone, right? So a project really is something that's a long-term venture that involves multiple parties, third parties to the county, and then internal partners and departments, and has multiple steps to implementation, and, of course, changes in cost as the project goes on. And so the quantity of those projects that I've defined going on simultaneously is only increased, and the IT director did provide kind of a list of those existing projects currently, those forecasted, and then those that it had been managing prior. And it's just an increasing trend, given, and I think it makes sense, given the growth of the county as an employer. In addition to those two additional staff members, there's also a request to reclassify an existing system analyst position to one higher pay grade and to call it a system administrator. And so that would have 3 system administrators under the infrastructure group of the department. When HR reviews these requests, what we like to do is compare service need amongst our organization and then what other county counterparts have in their comparable service departments. So that's the table that you see there on the right-hand side. So HR just boiled down the staff count for each of our county peers' IT departments, and then their workforce size that those IT departments are supporting. And based off that information, we can see that we do have a higher number of employees being supported by one IT staff. So that's the ratio you see in that last column. You can see our county there is listed last, so for every 58 employees, our county has one IT staff support person. Our total staff count there is 19. And you can see the staff count of some of these other counties is much higher. Bell County has 33, Brazos 35, Brazoria 35. Galveston has 45. And so their ratios, their staff to IT ratio is much lower. So they're supporting 29 employees to every one of their staff members. And so these adds to staff and the addition of this project management office, HR would recommend. I think it's in line with the organizational goals, and then also compared to our peer counties, we feel like our workforce could use the additional IT support. Are there any questions about this?
Questions?
Only comment I'd have would be, given that we know where we're headed with the rebuild of our old jail and everything else, we need to have, in my mind, have our IT staff up to par, numbers wise. And I don't know, just a thought, but Galveston kind of surprised me. I guess half of them are on the beach. I don't know where. So,
They're working
trying to
remote.
figure out-
Galveston, everybody's on the beach.
Yeah, I'm trying to figure that one out, but.
Pretty close.
Yeah, we definitely, they do a great job with the people they've got right now, and I know the direction we're headed in the future, so. My comment, enough.
I forgot to mention or point out, this request also, in addition to the adds of staff and reclassification, it does include quite a few title changes. They're not associated to any change in function or pay. The IT director just thinks those titles are more appropriate and more flexible for the functions that are needed to be performed by those positions. And HR would recommend those title changes too.
My comment would be that I would hope that we get to hear from the department head on their vision. Because I have the utmost confidence in John. I just want to hear John tell me about this piece of paper, since it's so different from the budget as far as titles. Now, there are some positions that are the same in the current budget. And what I mean by that, there's some positions that were under the last administration, so it kind of makes me see continuity of function. But then there's some totally different titles, and I know that comes into your vision. And the reason I ask that is we do let new department heads come in and shape their vision, but it's kind of like Road and Bridge. If a new commissioner comes in, then but the department is still gonna do the same function, so the infrastructure stays in place. So I need to just get an understanding. I know we're gonna do the same and better than what we've done, but we're changing the infrastructure, meaning how you're laying out human capital. And I just kind of need to hear that from you.
That's exactly what I want. John Carter, the IT director. Good morning. Good afternoon, sorry. So I guess I'll start with what Anna pointed out at the beginning is true. The only real big function change, if you will, is the project management office. So whereas every department probably manages projects, I'm sure they do, they don't always get done on time, on budget, or don't always have the outcome they're expected to. And I've seen that when I did my initial assessment, which all of you have now seen. I saw several projects that either linger in limbo and we're really not sure where they're going, or they terminated, but no one seemed to understand really why, or at least it wasn't clear and tied off and made sure that we have moved on. I don't know how many committed resources we wasted on a lot of those projects as well. And it's not just the big projects. I know, the bigger ones like the downtown jail are important, obviously, and we'll need to track those very clearly. But there's also very small projects that maybe you wouldn't even call a project. They still need to be managed. They still need to be tracked. And the biggest thing I saw that was missing in a lot of this is the documentation that you can then refer to later. There was very often the project gets completed, everyone's happy, but you never really get a tie-off of documentation. So if anything, you need to refer back to that project. For instance, EDOC is a great example of that, by the way. We've gone through, I know, over the years, and added on to EDOC, added a program, added this, added that. Where's the documentation? It's very hard to refer back to a lot of these things. Maybe or maybe not the vendor has that information. We don't. So we're often called to support things that we've either installed or at least worked with a vendor on, and we have no way to properly support that product or that staff or whatever it may be. So that's one of the bigger things I saw missing was just tying off the projects, making sure we're doing it efficiently and effectively, using the citizen dollars as best we can, and then making sure then, of course, that we can support it down the road. So that's the big change. With that, if you will, so our IT, we did have an IT systems, just called IT manager. That person was managing all of the, or is managing all of the infrastructure systems teams and is managing currently, the applications team. I see that as sort of a conflict. You typically don't have the same person managing systems as applications and infrastructure. They're just, in the IT world, they're just two different career fields. And usually that person's not adept at both. It's not so in this case that it was such a problem per se, but I just needed to move that application staff. There's 3 folks in applications. Need to move them over because most of applications work, and that's, when I say the word applications, think software, Microsoft, Office, Outlook, eDoc, Tyler, Munis. When you're supporting a product like that, it typically comes in project-like work, project-like bits, if you will, and bytes. So those line up under project management, and having the project management office be kind of your documentation staff, if you will, at least, not necessarily writing all documentation, but making sure that that is kept and indexed and you can find it later and that sort of thing. It just makes sense to have the application staff in the project management office. So I'm just basically moving 3 people out from under the systems manager and then moving them under the project management office. So as you know, I'm asking for a new senior project manager. I see the volume of work there, in addition to the expertise that's needed in that office, would require someone with some experience. And the big difference between that and, say, the project manager spot we have now is truly certification and experience. The project management certification is called a PMP, Project Management Professional. To even get that, you have to have some number of years' experience with the projects. You have to, again, pass a certification test, which is very rigorous. And typically that person comes with knowledge of the organization, of IT, organizations. That person would manage that office. The project manager and the 3 applications folks would work for them. Also, as I know we asked for last year, and I watched those, the audiovisual technician, that position is still needed. A lot of folks look at that and ask, well, what are we not doing now that we need to do with this audiovisual technician? So it's beyond just these meetings. We have some great audiovisual technician people here, someone with great experience, as you know. Also our project manager. So that does, take away from project management duties he does have elsewhere. These are, a lot of lengthy court sessions, especially now when we're talking about budget. Beyond that, we do have plenty of conference rooms around the county that either don't work at all with the technology or work don't work very well, I would say. Then we talk about courtrooms with all the technology. We just had a lot of technology, and then add on the projects, in which every project you have now will include a lot of audiovisual technology. There's an increased need. I still think we have a lot of things around the county that just, again, don't work as well as they could for these sort of things. We just have the need, again, volume of work for an audiovisual technician. And that would be someone who's dedicated audiovisual. That's part of the issue, I would say. It's just splitting someone's time so much that they don't do either job as well as they could.
Okay, and I see your schedule for tomorrow.
Yes.
The last question for tomorrow you can answer. We're changing names, but we're not necessarily changing salaries.
So yes, so the title changes where it says title change only, that's really to reflect what they're actually doing now already. We call them currently desktop support technicians. As probably anyone who's interacted with them, they do everything. It's not just desktops. They do everything across the spectrum of IT, including they're all learning how to, well, a few of them are learning how to do the courts and run all the audiovisual for that and other things.
Okay. And we'll talk more tomorrow.
Sorry?
We'll talk more tomorrow when you're
Okay.
scheduled to really come.
Nope, absolutely.
Okay.
Any
I have
other-
more questions, but
Okay.
you're scheduled for tomorrow.
Perfectly happy.
That was
Anyone
my
else have
mistake.
questions on the personnel part?
Thank you.
Okay. Thank you all.
Thanks, John.
Is it just name changes?
For IT? For the IT department, it's to,
Is it just name changes?
for the IT department, it's 2 adds to staff.
Is
And
it just, is it just name changes? Or is it salary changes?
I thought he said just name.
Name-
yes, for the title changes,
It's just
he
title
has
changes?
just title changes.
Okay.
And then there's 2 adds to staff
2 new staff.
and 1
Okay.
reclassification that
Gotcha.
would be a request in budget
Okay.
change. Sorry. And then the remainder would be just title changes.
Okay.
Okay. The next large office that we have, that it has multiple requests under new leadership is our criminal district attorney's office. And so this is the organization that they're proposing now. They actually aren't really changing a whole bunch or kind of reworking their entire organization at all. They are still keeping the current tier systems for their assistant district attorneys, and so there's ADA 1s, 2s, and 3s. And what differentiates them is the complexity of the cases that they're handling and the years of experience that is required to enter each of those positions. So they're keeping that tiered structure with a lot of their ADA 1s handling things like misdemeanor cases, their ADA 2s and 3s more so dedicated to felonies and more complex divisions such as juvenile and crimes against children and their appeals division. So that is what's currently in place, and they're maintaining that. One of really the big thing that this request includes is support. More support adds to staff. So the key component of this request is there's 6 adds to staff being requested. That's 6 full-time positions. But their existing titles, there is what's being requested for adds to staff. So it's a request for a one DA clerk, 2 tier level 3 ADAs, 1 legal assistant at a tier 2, a criminal investigator, and a victim assistant coordinator. They're all existing titles with the functions already defined by existing positions, and they just need more support and more staff to handle their work volume. That's really the primary component of the request. Another request that they have is related to the administration of their office. And so currently we have 1 first assistant position, and we also have what's called a ADA executive position. And so currently, they're using that ADA executive position really to share functions with the first assistant. And so the request for fiscal year '24 is to actually reclassify that ADA executive position to a first assistant so that there are 2 first assistants who divvy up leadership by division amongst these, in addition to dividing up the divisions underneath these 2 first assistants. They also want this position to be titled First Assistant Chief of Operations so that it's clear that one of the functions of this proposed first assistant position is to manage some of the more operational aspects of the office related to budget, policy, and whatnot. So, and they also made it clear that actually between these 2 positions and of course, the district attorney, that they manage strategy for all major cases as a team of 3. And so they want their administrative lead positions to reflect that collaboration between both these first assistant type positions. When HR and the district attorney's office kind of came together on how to break up leadership and administration of the office, the proposal kind of agreed upon was this 2 first assistant structure, 1 chief of operation and 1 chief of courts, which is the existing first assistant position. That title request didn't get submitted, and so I just need to get with the district attorneys to make sure that that is something that is still intended or still part of the request that they're wanting to submit. 2 first assistants isn't unheard of. It's something that does exist. It's not as common, but it is something that other counties have in place. So it's not some extraordinary circumstance. I say the major component is the add to staff to help support their work volume. I can actually, my next few slides are about actual work volume. And so just to showcase what it is they're talking about. So under this slide here, I'm on page 19 of the presentation. I pulled information from the Department of Public Safety. I feel like this data best displays that work volume that they're attempting to address with these 6 adds to staff. And so I have all of our county peers listed here, and the most recent crime in Texas report available from the Department of Public Safety is from 2021. So that's the most recent information available, and I pulled data on the number of offenses, rate of offenses per 100,000, the number of clearances, which means how many of those offenses actually reached a completion or arrest, and then the actual number of arrests there. And so you can see compared to our county peers, McLennan has the highest rate of offenses per 100,000. And then the last row there, basically we have the highest volume of crime in 2021 compared to our county peers, but we have the lowest staff count for our district attorney's office compared to our other peers. So on average, our county peers have a staff of 80 in their district attorney's office managing the crime and arrest for their respective areas, and McLennan County has 64.
David, have y'all seen these numbers before?
Yeah, we've been the ones that told them about it in the first place.
It seems like
Every year.
it's a category we don't always want to be the leader in. But
We have a very detailed report if y'all like some information on it.
So the McLennan County figure includes crime reported in all of McLennan County, so that would include all law enforcement agencies.
Get the weather.
It was the weather.
Oh,
It includes all of the agencies within our county, so Waco PD would be included in this figure, and so,
Always tell people if you're arrested in West. What is that?
so if you're arrested.
If you're West, or at least, or Bruce Villetti, or Mart or McGregor, you're going to the McLennan County Jail.
Yeah. Yep.
and so this is some of the volume, that the district attorney is referencing when stating their need for staffing. And so based on the staff that our other counties are working with, the other district attorneys are working with, and the crime in their areas compared to the crime in our area, and the staff our district attorney is working with, HR would recommend adds to staff. We would say they are understaffed.
Yeah, and, you want to look for choke points, and that may be one. And so we need to be sure that at least through this piece of it, we get them to this point so they can either be prosecuted, dealt with through the courts. But it looks like that definitely could be a choke point, so we need to free that up. I'm just hoping the courts can handle the volume.
If we don't have any questions on the district attorney, I can move on.
Any questions?
No, other than
So I
that,
guess so the question becomes, I mean, why do we still only have just the two? I mean, what courts are these arrests going to? And I guess that comes into their, if they're all going to two courts, when we have.
how many district courts do we have now? 4?
Well, it'd actually be 5. So
Five.
misdemeanor would be our county court at law level. There's 3 of those, and then our 2 felony courts.
I think looking at those numbers at the bottom, still, when you look at Galveston and Brazoria, those are kind of outliers in my case, in my mind still, that are way bigger than we are.
Okay, any other questions, comments? All right, let's move on.
So I kind of touched on this last budget, and so this time I've just gone ahead and incorporated assessments on work volume for those departments under the county that do report to an outside agency. So for our courts here, I did an assessment on the type of work volume we're seeing now and have through a 5-year look back. And so this is all information that's reported to the Office of Court Administration. And so these are reports that you pull directly from their sites. And so we have 2018 to projection for 2023 included here for our civil courts, our justice courts, our justice of the peace courts, and then our county court at law cases as well. So to kind of Mary, the information that we just kind of went through with the Crime in Texas report, that was just a snapshot. That is 2021 data only. And what I've pulled from the Office of Court Administration, I've pulled annual data dating back to 2018 for these courts and then 2017 for county court at law. I have included there. And so you can see kind of the trend is the same across these courts and where there seems to be a 5-year decline or downtrend in cases added for county court at law and justice of the peace courts. Because our civil courts tend to have cases that are a lot longer, instead of cases added there, what I've done is included cases on docket. So that's just how many cases are on their docket in that year that is reported on. And so this is the type of information, along with the compensation ratio, that HR uses to assess any requests coming out of these offices. Next, we have work volume review for law enforcement. Again, this is the district attorney information that I share, and it's just that 1-year snapshot, 2021. I did also include constable activity. This isn't from an external agency. This is from internal EDOC reporting that I have included for constable activity, and that's papers received. That could be papers received. That includes evictions and all of the legal documents they're expected to deliver by order of the justice of the peace. And so that's what included there. And again, there's been a 5-year downtrend with just a slight uptick here for this year's activity compared to last year being projected.
I guess what I'm not understanding, and tell me where I may be doing apples and oranges here, but if the number of offenses is going up, how are the number of cases being added going down?
So that's why I identified that this is just a 1-year snapshot. So that's not saying that crime is going up. This is just the crime occurring in 2021.
So we don't know in 2020 if the number was greater or smaller than that number that you show on page 19.
Right, but that's an easy number to, 2021 data is available on that DPS or Department of Public Safety website.
It just seemed like to me the cases being added would go up if the number of offenses were going up. Does that make sense, or am I not seeing something?
Is that right?
I don't know, because offenses is not one-to-one for the person. In that, aren't we counting the people under number of arrests?
So we may see a trend, it could be upward or downward, but I would need to pull 2020, those years that I've included for those courts, I would need to pull that same information in this Crime in Texas report and put that together to see if they correlate, or they should correlate. But I'm not saying there's a differing trend between the crime and the cases, because this is just a 1-year snapshot.
David, you have an observation on that?
We have done that. We have that data currently right here on my laptop. The correlation is there. It does exist.
Okay.
Go back to my point, because we're looking at offenses like that's 7,000 people. But really, the people is under the number of arrests, correct? We're talking about 2,134 people
That have been arrested.
that have, and those people have the 7,651 offenses?
Yes, ma'am.
Okay.
So we can provide that, so that I don't have to do the work. I could just get it from David, if that's something the court would like to see.
Because you put it on staffing. You put it that the district attorney is asking for these additional people because they have all of this crime, but they're gonna try by person, although they're gonna have all of those offenses, but they're not gonna try by offense. They're gonna try by person, right?
One person could have committed multiple offenses.
As,
what you're saying.
yeah.
Right.
Really, how many people are in jail waiting for a trial?
1,347.
Some are right on bail waiting trial.
And that's
Well, that's-
U.S. Marshal, a little under 300.
And
Well, I
so,
guess what I'm trying to get a mind around is if we're looking on, workloads in different departments and all, you would think that over in the judicial side and the court side, that you would see just a ramped up increase in volume, and maybe it's delayed. Maybe the number baseline that we're looking at was a COVID time, but I don't know. I guess, and the surprising one is the amount of activity in the JP side. It's just really dropped off tremendously.
Right.
Just wonder about all that.
Yes, and then with the civil, because it's civil, that's not really related to the crime in Texas
Right.
report.
Well, that's true, but I'm just talking about overall work on the folks that come through the courthouse. We went a long time without jury calls and all that, and now we're trying to catch up. And so there's got to be, we got to be working on some graph right now that's later on when we look at it, it's going to have the number that's
Right.
in a trend, and we need to know that. In thinking about staffing from, after the arrest on, from all the way from the jail, but also what happens when they deal with the issue, whether it's plead or whatever, goes trial.
Right. And in the past, for adds to staff, HR had compiled a comparison of staffing for courts. And so we didn't see a stark difference in our county peers and the staffing amongst their courts and our courts, where HR does identify quite the difference between the staffing in our district attorney's office and our peer counties. And so that was kind of the main thing we wanted to highlight with this Crime in Texas report, and then mostly is just that staff count and how we're 15 or 16 full-time positions under the average of our county peers staffing for the district attorney's office.
Do they break their statistics down between felony and misdemeanor? When I look at this number, because I know these are not all murders or assaults,
No.
are some of these DWIs, or some of these child support
They do break it up by
violations?
offense type.
Okay.
Well, good information. Don't know if I totally understand it, but as we go along, and Captain I has been very helpful in helping us understand some of this stuff. And when our DA comes up for air, we'll get a little bit more information out of him as he's learning every day in his new position.
Sure.
So, but I think everything we're seeing in McLennan County, whether it's economic growth or crime statistics, and everything's growing. And, we're trying to keep up with it, do it judiciously. But,
Yes, sir.
yeah, appreciate the information.
One more group of information here before we can actually get into our request. And so that's information related to historic vacancies at the county. And so a question was asked about, if we can see if any one particular department has consistent vacancies that have lasted more than a year. And so we just pulled those existing vacancies that we have now. And there aren't really departments that have vacancies that have existed for more than a year with the coming out of the general fund, with the exception of our jail, which would include the jail and Jack Harwell Detention Facility. So once narrowing it down to that department, what we've done is just for the current fiscal year and the previous 3 fiscal years, we just included how many positions are budgeted in those departments total, and then compared that to the highest employee count for each of those years that we're reporting on. And so we've put that together here on this table. And then also, in addition, for this year, we've taken away the positions that are just dollar placeholders that aren't funded. So once we take those away, we see that there's 338 positions between the jail and the Jack Harwell Detention Center. And so far this year, the highest count highest count of a month is 309.
So going back to 27 positions, 2176, 2285, and currently you're sitting at 50. Difference between budgeted and actual number.
Take the dollar out, it's 29.
Right.
What happened?
If you take the ones that just dollar placeholders out, it didn't impact our budget numbers, then it's 29. So,
Oh, okay, I see, because 38 to, yeah, okay.
Yes, sir.
Threw that number in there on the 20, 21, 21. Okay. Okay.
And so this is just information that the court wanted to see. And so that's here for the court to consider. If there are no questions on that, we can,
I would just ask, Major to, maybe it doesn't have to be now, but, before we get through the budgeting process, to come back and help us understand having 29 in there that hadn't been filled. And so if it's not that number, what number would be a number we can look at? Okay. Okay.
so I've tried to cover the major changes that are being requested and highlight, groups of interest to the court. And now, just depending on how the court would like to break up the review, we can jump into the actual individual salary adjustments and adds to staff that are being requested. There's a total of 96 of them. And HR has reviewed each one of them. And we have data to support 44 of the requests. In previous years, the court has decided to review those requests. It seems to work best when we work off of the auditor's office spreadsheet because it's easy to filter for those departments of interest. And then also on their spreadsheet, they've been nice enough to include HR's recommendation as an actual column that you can filter for as well. And so this year that's been done as well. That's already in their spreadsheet. And what HR has done is, again, reviewed each request, and for each request, depending on the data HR has or doesn't have to support the request, we've designated each request with either a yes, there's data to support, a no, we don't have data to support this, or there's insufficient data. A yes, no, which means we think this is a good idea, there's support, but we may not agree on the exact dollar figure that's being requested, and we would recommend a different dollar figure. And then we have another where HR data might not be applicable for the specific request.
Okay.
Or we're bringing a position that wasn't presented by the department to the court's attention. There's only a handful of those.
Do we have a printout that shows the total personnel requests reviewed by HR, by department or office, and a then corresponding total personnel requests supported by HR, or yes, no, or zero? Do we have a printout of that?
So it's on the budget workshop drive.
Yeah, but I
think if we
mean,
printed
did you,
it, it
did
would-
you send any, give us anything today?
No, I think if we printed it, it's a
It
lot
would
of
be
columns. It
hard
would be
to
really
read.
difficult to follow.
Why would it have a lot of columns? If you had one office and said they wanted two and you'd said no, how many columns do you need?
Well, it has a lot of information provided.
Well,
by
yeah, but
HR
I'm not,
and the
I'm just
department.
asking, but obviously they're just,
Position, there's
I'm just
title,
asking
there's
for
salary,
the numbers
pay,
that HR
operation.
supports or doesn't support. By office, or, yeah, that's a lot more information than I would want.
So we'll pull it up on the
I'll
screen
tell
as
you,
well.
does
We're
that
gonna
make sense?
filter it by department.
well, I think we'll give you an option. You can look at whatever you want to of it, and don't look at the rest of it. We're gonna look at all
Put
of
it on the
it.
Okay.
screen.
this spreadsheet, and we looked at this last week. Oh, last report here. There's one tab and it's a summary. So that number at the bottom is an all-in number, all the requests we received. They're in the following tabs, which we'll walk through here in a sec with Anna. But this, as we check if y'all are good or not good based on HR's recommendation, those decisions will filter into this sheet so we can continue to check what the total cost is for what we've gone through. And it includes FICA, Social Security, retirement, life and health benefits, equipment that may be needed. So we've tried to give you an all-in cost, and we'll keep updating this. So I think we'll just walk through each department. Is that?
Yes, that's,
Okay.
I think that seemed to work well last year, if the court agrees, is going department by department. And I mean, we can start with the sheriff's office since they're here.
Okay.
Yeah, let's
And
start.
Okay.
And we'll look at it in groups, so there are changes to current positions, and then there are new positions, and then there's some other miscellaneous requests. So we're gonna start looking at changes to current positions first.
Okay.
And we're gonna pull up the sheriff's office and related departments. And again, I know that's, if you don't have it on your, let me just collapse.
Great. So here again, these are existing positions that these departments are requesting adjustments for, or a title change, or reclassification, or sometimes both. So, or all three. So the most common change that you're going to see here is a salary adjustment requested for RN positions across Jail Medical and Jack Harwell Medical. So HR is supportive of that request. We're not getting any applications for nurses, is the short and sweet of it there. There were discussions last year when an initial increase was presented last summer, and the court did discuss the possibility of revisiting this request should that initial increase not work, and HR is reporting that it is not working. And so that's the reason for the yes there. We normally don't or aren't supportive of increased requests for positions that are above a 1 comp ratio unless there are extenuating circumstances. Not getting any applications would be the extenuating circumstance here. So after the RN position, we have another medical position, and that's a certified medical assistant, position number 1239. This position apparently has been functioning in a lead type position, training the other certified medical assistants, and that's a large staff of certified medical assistants. And so we did incorporate those functions into the existing job description. There is a change in pay grade being recommended by HR. This is one of those yes/no positions or requests. And so, yes, the function or the duty does warrant a new pay grade classification. However, the amount of the request would bring the comp ratio above a 1.2. So we wouldn't recommend the salary that is being requested. We would actually recommend a differing salary, a lower, yes, a higher salary than the existing budget, but not to the extent that they have there. What we would recommend, here it is $47,229, which is the midpoint of the new pay grade and would bring the comp ratio to 1.05.
My question would be, is the salary too high or is the pay grade too low? Is that the pay grade that you assessed to it when you looked at the information they submitted?
Yes, ma'am. The CMAs currently are B5s. They're all B5s. And now with this kind of lead trainer function that the department identified, that brought the pay grade to a B6. And so the existing budget is 44,755, and HR would recommend a budget of 47,229.
Under 3,000, your recommendation is under $3,000 to be the lead trainer, correct?
Or an additional $3,000?
Yeah, the amount that you're recommending is a little bit under $3,000
Oh, yes.
for that position of being the lead trainer.
Yes, sir.
Okay.
You have someone in that position right now? Or is it vacant?
There's someone in that position.
Someone in there?
So next from there, we have a nurse clerk position. Nurse clerk is not really a title that is common in the medical field. So both the department and HR would agree it needs a title change, and that should be a health services assistant. There is a requested salary for that position, an increase of $4,206. This is another yes, no, while we do recommend the title change because it is more in line with industry titles that are common for those functions, we would not recommend the adjusted salary. The salary as it currently is within the recommended compensation ratio range. So the current compensation ratio is a 1, and there are no changes in functions for that position or additional functions or change in complexity of functions to warrant an increase. So in addition to the RNs, there's a patient care coordinator title. It should be treated like an RN. That position does require a registered nurse license. And so, like the other RNs, its salary should also match.
Okay. It's an RN called patient care coordinator?
Exactly, yes. The next one is just a title request, again, to be better in line with actual industry titles from a medical clerk to a patient care clerk. And that's just so that it matches that other patient care coordinator. We have a coordinator and a clerk who both function in patient care. Are there any questions on the medical request? Because I think those are the only requests we have related to medical that are full-time positions. I know they have a PRN request as well, but for full-time staff, these are the position changes that are being requested for medical.
Any questions up to now? Okay.
So moving on now, we have requests for jailer staffing. And this request here, HR is in support of. So they're really just wanting to move these positions between the jail and the Jack Harwell Detention Center for staffing needs. There's not an additional position being requested or an add to staff or anything like that. It's just moving these positions to the other side. There's also a request for, under the SO, we're moving, from the jail to the sheriff's office. Now, there are two requests here for existing positions. One is position number 827. It is currently a deputy position. There is a request to reclassify that or have that actually function as a corporal. So that would be an increase in pay grade and an increase in pay of an increase of $12,163. This position supports their personnel division. And the request, I'm sorry, I'm trying to look for it here in my notes to be sure I give you all the details that we have. So they want this corporal position to function in a lead type role under the personnel division. HR has a no for support in this position, and that's mostly just based off the existing ratio of lead type or ranked position already in that division. So there are, under personnel, 5 ranked positions that are corporal or higher, and there's 5 non-ranked positions or civilian positions. There's a few deputies and then a couple civilian positions. So that's a 1-to-1 lead ratio, and so that's why HR doesn't assess a need for an additional lead type position in a corporal position. The next request here is just a change in, it's a change in title and functions, but it's not associated with a reclassification or any pay adjustment. Last year, there was a request to convert or separate what was a combined investigator corporal title. They decided to separate those titles and functions so that it was clear this position is performing as an investigator, this other position is performing as a corporal that is in charge of, leading a group of individuals or serving as a senior person to a group of individuals. There was a position that was missed, and that's what this is. It's just, we forgot this position. And so they are just wanting to switch that investigator title to a corporal so that it functions as a corporal. It's the same pay grade, the same pay. So HR has a yes on that for support. That covers all the position changes related to the SO, jail, and medical divisions. Does the court have any questions about this?
Any questions? Of course, we'll come back and look at this again. No further questions.
Okay. Do we want to then look at the new positions for the same department?
Okay.
Yeah.
So here, there are, they're listed as, new positions or add to staff, but a result, if these are approved, would be they would then not need associated jailer positions. And those are listed in the comment section towards the right of, what position numbers are currently jailers and wouldn't be needed if these deputy positions were granted. And so all but one kind of fit that explanation. So the, let's see, the only true full add to staff that, is not in existence would be that first line item, which is a new deputy position for security for the 474th District Court that's currently having security provided by private security, I believe. All the other district courts have a deputy performing their security functions, and so it would stand to reason this one.
And there would be an offset there from not having to pay the security, right?
Exactly.
Be some offset.
And so that's one out of
Would
staff.
this be the one that meets you at the door, that's got to happen?
I actually don't, I know who you're referencing, but I actually don't know if there's 2 security personnel over there and one of them is the door person. Okay.
He needs to rest somewhere else.
I believe so.
The next position listed there is a deputy position. I guess the proposal there would also, they wouldn't have a need for a jailer position. But this deputy position number, I'm sorry, not number, is being requested in order to have the position perform as a pilot. I don't have any details in work volume being performed currently or what the need is now. For pilots, we just know that we currently, according to what's being reported to TAC, for insurance purposes, we have 3 pilots on staff and 1 reserve pilot. So we would need to know how much work is being managed by those employees and that comparison. The other positions, I'm sorry, there's one more that's a little different. So there's also a deputy being requested, again, would be offset by giving up a jailer position. The person, this is a filled position, it's currently a jailer. They would like this position to be a deputy. They are a peace officer. They're performing background investigations on applicants for the sheriff. So those background investigations are being managed by a group of 3. The other 2 counterparts to this person are deputies. And so HR has a yes for support there if we already have 2 deputies performing those functions and we have a 3rd person performing the same functions. They should also be in the same classification and title. So HR would support that request to have that be a deputy position. We are again starting to see an uptick in application. We hope that trend continues, but the Sheriff's Office has reported a difficulty in actually getting responses consistently from applicants during background, completing their packet, all their required documents that they have to present before passing a background. And so having a full staff to be sure we're getting applicants to the finish line is needed. The remaining 4 deputy positions, these positions it's needed to perform transport functions, specifically out-of-state transport functions that require a peace officer to perform. And so that's according to TSA rules that the Sheriff's Office has shared with HR. And so if this is some sort of legal requirement that they have to have peace officers performing this function and they currently have jailers in support of the function, then HR would support that need. And I believe that's it for the new position requests. We can move on to miscellaneous requests if there are no questions.
Any questions? All right.
And so here, for the Sheriff's Office, the requests under miscellaneous would include the certificate pay that has already been discussed. And then the other is part-time pay, an increase in wages and thereby budget for part-time pay for the PRN or the hourly RN pool. HR has a yes by that. It's honestly just an alternative to if we cannot, even if the court were to approve an $80,000 salary for RNs, we still may not get applications. And so we don't think it's a bad idea to have an alternative and having a more attractive hourly rate for PRN. PRN work among registered nurses is a common, is more common than it would be in other fields of work or industry. And so I think combating that both from a full-time position and a PRN position is a good idea. And so we would have a yes on that. And I think that covers all of the personnel-related requests for those offices.
Any questions?
You're giving a recommendation against the certificate pay? And scroll over to my, or you just need to review it some more?
Before I can fully recommend certificate pay, I would really need to see at least an outline of a policy to see how it would be implemented. Just because whenever you associate pay to additional training or it, we just want to be sure that it could be administered just in general and then equitably to be sure no liability is created.
Go ahead, Judge.
Well, the concept looks reasonable. We just need to see the details on the policy.
Yes, sir.
Right?
Yes, sir.
Where are we on a policy? Have you looked at one at all? Have you started it on one, or
No, sir.
reason?
I have not. I don't know if the department has.
Can you get with them?
Yes, definitely. Another item to point out to the court, I have already been contacted by a constable's office who I guess is aware of the certificate pay request, and they would also like to be included
Okay.
in the program.
And the only reason I kind of highlighted is I noticed on your 9 counties on that table that 5 paid higher, just their base salary was higher than ours. And then, you know, we're gonna ask them about their 29 vacancies. And if we're looking at recruitment and retention tools, that's the only reason I highlighted. I think it warrants further study.
Yes, ma'am.
When you refer to titles that people are requesting, and you said it conforms to this guideline as far as what they're doing, but the industry standard is this name, there's no requirement that they give them that name, is there? It's just that industry standard. So if they want to call them ABC and it conforms to what the industry calls XYZ, they don't have to change that, I mean, do they?
That's correct. No,
That's up to them, right?
that is up to them. HR does look at that just because should positions become vacant and they have that existing title that is industry standard, it's more likely we'll get applicants for the position because that's what applicants will be searching for when they go on to Indeed, or they'll be searching that title. And so that's why HR would recommend sticking with an industry standard, is to ensure applicants can find our posting. And it also makes our compensation review every year, it also makes that a little easier too, because that title will be more common in our salary studies from Texas Workforce or Oakland, so those would be reasons.
Okay. Anything else in that department?
No, sir.
Okay. All right, let's take a 5-minute recess and then we'll come back. All right, let's call court back into session. All right. Lonnie, you're still here?
Yes, I am. I came back.
Okay. Carry on.
Okay, so we'll just move back to that same spreadsheet that we were working through, and we'll bring it back to the position changes for existing positions. And we'll go back to, since we've completed the review of the sheriff's office, we can go back to the top of the list for departments and then just chip away at it department by department.
Okay.
Okay.
Are we gonna go over any department that didn't ask for any changes? Or can we skip those?
Those are not on this.
They're not on this list?
as-
Okay,
they're
very
not
good,
on-
that's what I'm hoping for, okay.
Can you organize it alpha by department, not
Yes, yes.
location code? Thank you.
Yes, whichever way.
Does that work? Yes, thank you. You made me panic a little bit there.
No.
So up first, we have a request from the 170th District Court for both of the court personnel or positions under that department. The court administrator position and the court pro se position. It's an adjustment of $5,000 for each of those positions. HR does not have support for either of those requests. Just based on the current compensation ratio, which are 1.02 and 1.07. There's not a change in function that was identified within the request that would warrant any kind of review of classification or anything like that. The next request we have is from the, I don't know if we want to pause for discussion after each.
I would say that if somebody disagrees with what your recommendation is, we can pause and talk about it. Otherwise, just take a slow pause, but go on through if nobody says anything.
Okay.
And then we can always come back after we thought about it more and see what we want to do. Does that
Sounds
sound all right, everybody?
Yes, sir. So next we have a single request from the 19th District Court for their court administrator position. It's a budget increase of $1,000. That's also does not have support from HR, again, related to the current compensation ratio, which is at a 1.02. There is no.
It's 19? Yeah. Okay.
Yes, sir. The 19th.
Thank you.
The next request we have is for Constable Precinct 3. And here I left this is the actual official requesting an increase for their own position, is what this request is. And it's a request to increase the salary by $3,337. Because we kind of grouped them together with the other constable's office, and we have an overall recommendation currently and also an alternative in the works. We left both this request and a request that a JP submitted as an O or as an other, because I figure the court would want to address those as a group.
I'd say that's correct.
Okay.
And then, so you're showing the comp ratio after like over here, 0.75 obviously is with the increase in it.
That is the resulting comp ratio from what the official actually requested.
Oh, okay.
What HR is recommending to bring it to a 0.8, so it would be a higher salary with what the official is requesting.
Okay.
The other request coming from Precinct 3's from Constable's Precinct 3's office is for the chief deputy position. The request there is to increase that salary to $4,333. With the reasoning being that they want to bring that chief deputy salary closer to the chief deputy salary of Precinct 2 and Precinct 1. However, this chief position does not supervise any full-time deputy staff like Precinct 2 and Precinct 1. So we don't feel like the comparison is warranted, and so we would have HR support for that at a no, because it is currently already at a 0.86 ratio, so it's above a 0.80. Next request, we have the district attorney's office. So in addition to kind of the organizational changes that I've already highlighted in that org chart, identifying there's 6 adds to staff and a reclassification of the ADA executive position. The district attorney also submitted basically a salary adjustment for every single position within their department. It was every position, I think, right? It was almost. And most of those salary adjustments don't have any HR support based on the compensation ratio. So whereas HR could find support for the additional adds to staff, we don't have any data to support a need to adjust each individual's salary for current positions. They're all ends based on the comp ratio, with the exception of, I believe, 2 positions. Can you filter the yeses for me? So we have 2. One of them, the first one there is that reclassification I've already described to the court for the first assistant position, or proposed first assistant position. And then the second one, there is for an ADA Tier 2. It has a very low current compensation ratio compared to the rest of the department. We just think there was some sort of error here with the budgeted salary. It's closer to the budgeted salary of an ADA Tier 1. So there's a large discrepancy there. And so HR is really seeing this more as a correction, not really a kind of requested salary adjustment. And so that request to bring it to $97,443, HR would support that specific request. So of the salary adjustments, these 2 are really the only salary adjustments to existing positions. These are the only ones HR would have support for.
Okay.
So we can move on then. I think the district clerk is next. That was a big chunk of the 96 requests, by the way, so. For the district clerk, there are 2 requests. We have a request to increase the 2 lead positions under that department on the civil side and the lead on the criminal side. They're both currently at $50,083. That's right, yes. And the request is to bring them to $62,000 each. That's an increase of $11,917. This is one of those yes/no requests where, yes, HR does support the need to adjust these based both on the comp ratio. They are one of the lower comp ratios count across all county positions at a 0.9. And there's been quite a bit of turnover in those positions, where overall for the district clerk office, there's turnover, but to have turnover in training positions, that's not common. And then it is a struggle, is causing struggle for that department when you lose a trainer to help those who are new to the department. It's hard to maintain their essential functions. And so for this, we have a yes, there needs to be an adjustment or should be an adjustment, but not in the amount of almost $12,000 each. HR recommends a salary of $55,500, which would bring it to a comp ratio of 1 and would bring it in line to, closer in line to lead positions in comparable departments like the county clerk's office.
So we're not increasing them because their functions are changing. We're increasing it to retain them.
Right, to try to reduce turnover in those two training positions, but they have functioned as trainers and lead type roles.
And the comp ratio would be, with your recommendation, would be what?
Is there
A
another-
1,
What, man?
it would be a 1,
Oh,
1.0?
One.
Even?
a 1 even.
1 even, okay.
I'd agree with that.
Okay.
What do y'all think?
Yeah. I think that's,
Yep, yep, yep.
The next department we have is IT, which we've already kind of reviewed at a surface level. These are the individual budget-related requests. And so a lot of these are just those title changes we referenced for the desktop group. You can see the change there from desktop support specialist to IT technician, with the tiers remaining the same. That tier structure of 1, 2, and 3 would remain in place. It's just the title before that would get updated to be to encompass better the functions of the position. HR would be in support of that. Following the title changes, we have, again, those that don't have any salary adjustments associated with those. The next one that would have an adjustment associated with it is the system analyst position 1412 for this position. For this position, based on how the department does want to structure the organization, it would make sense to have this position function as a system administrator. Also, historically, when posted, that position has had a hard time attracting qualified applicants. So I think a system administrator with a higher salary would better attract qualified applicants. It would involve a reclassification to an A32. That's the recommended classification. And then the recommended or the requested salary is $86,817 for an increase of $6,838. The next two, so the next line item here is an HR recommendation. This actually wasn't brought forward by the department. When a department has this many changes, one of HR's roles is to see if there are any subsequent changes to existing positions based on duties that'll be added by additional roles. And so with the addition of a senior project manager, if that were to be approved, the functions of a senior project manager are oftentimes to have a sort of final approval over change orders or agreements and things like that. And so if this position has that authority, would the existing project manager then have that authority? So we confirmed that with the department, with the IT director, and that would be a change in function for the existing position. And so reassessing that position and its functions, HR came to a reclassification to an A31. But even with that reclassification, the existing budgeted salary is not, it's still in line even with that reclassification. So there's not a recommendation to change that. It's just we want to point out that this is something that we would recommend in reclassifying if we take on a senior project manager position under the department. Any questions about the IT? Was that all of it, Haley? Okay. except for the new positions. They're on that other tab. Oh, okay, yes, and then it has new positions. So the next department under just position changes. We have is a JP office. So this JP position, this is the actual official requesting an increase for their own position. And again, as I stated for the constable office, it'd be best to look at these as a group. But there you could see that their requested increase would actually bring them to a 0.84, and the HR recommended solution currently would be changing it to a 0.8, so we would have recommended a lower salary than what's being requested. The next department is JP3, requesting an increase for clerk position 219. It's an increase of $4,075. The existing comp ratio is a 1.01, so HR support for that is a no. The following department there is JP5, requesting an increase of $750 for that clerk position. And again, that ratio is 1.01 currently, so that we wouldn't have a HR support for that. Neither of the positions have a change in function that would warrant review of classification. Following that, we have maintenance of buildings. So maintenance of buildings actually didn't put this forward. This is HR identifying this just after being aware that the trustee program is no longer in effect, and these three positions were performing functions of jailers and inmate work crew supervision. And so we're just identifying this to the department, but that if they're not performing jailer or trustee functions, then they should be reclassified to maintenance tech 1 positions, which would mean they would not be eligible for step pay. However, the department head did let us know that they are currently working on a program with our adult probation department and supervising probationers in their community service.
Where are these people currently located? Are they over at MOB?
Right.
Okay.
And they're performing technician 1 duties for the most part, but they have also been coordinating the custodial efforts of the third-party vendor as well.
So they're not SO employees, they're not certified peace officers,
No, they are certified jailers.
they're certified jailers, okay.
So HR is just bringing that forward on the list for consideration for the court. TJ let me know that he has something hopefully going to the court in this next regular agenda item related to this adult probation supervision program. That he's hoping to have these positions function under that program and still some sort of supervision capacity over now not inmates, but probationers.
So do we switch back to that grade? I mean, that just,
I think that would depend on what was decided once the court
okay.
was presented that program.
Those aren't
Okay.
inmates.
pardon me?
Those aren't
No,
inmates.
they're not.
Well, I
they're
know, but
probationers.
they're, do they require to be managed by someone with jailer credentials?
I do not know the requirements for supervision for probationers.
Okay. Okay.
So just making court aware of the changes of the functions so far that have occurred. However, there's a program on the horizon that may still call for a need for them to be functioning as they currently are classified.
Okay.
The following department we have is pretrial services, who is requesting an increase in salary. And, oh, I'm sorry, I didn't realize there was a title change request as well. So it's currently a pretrial services assistant, and the request is to have it be a pretrial services assistant coordinator. The request is to increase the budgeted salary to by 2,325. The position's already at a comp ratio of a 1.08, so HR does not have, there's no HR support for that function. I know the Judge Bain mentioned in justification for the request that it wants to have it match the salaries of court admin assistants. But court admin assistants and this pretrial service assistants are actually in different pay grades, and the functions are different. And so that those functions, we have had Judge Bain identify them, and we've reviewed them just to be sure that's not a need for classification change. And at the moment, it's not, based on information provided thus far from Judge Bain. The following department is Road and Bridge Precinct 4. It just had a position reclassified to a crew member position to establish an entry-level type position in its precinct. And so there's a request here to increase this position to $2,000 or by $2,000. The existing compensation ratio is a 0.9, which is on the lower side, but it's still within the 0.8 range. And it's a newer type position that has an experienced turnover. So given that, the HR support for that is a no.
That's a very scientific formula that you have. But I have a question. Because we talked about this position, and I know it's going to be, hopefully it's a stair step, that the individuals that are coming into our road and bridge departments, and sometimes we have a little difficulty, and this allows people to get the training in road building without the Class A CDL. As they progress, leading up to getting their Class A CDL, don't we want to give them the incentive to earn incrementally more money? Because these are people that they are gaining experience in road building, and they're out in the elements. And so don't we want to give them a financial pathway to full-time employment? Are we taking any of that into consideration, or are we saying, since there's no turnover and you're at a 0.9 comp ratio, we really don't see a path to increasing that base salary?
HR would always like to see kind of that career ladder in place and opportunity for growth. And yes, you're right, that was kind of the designer intent behind the position, is to have them learn hands-on, plus even at some point, if allowed by professional development budget, have them also somehow be able to earn a CDL, whether it be on county time or their own time. But until a threshold is created for kind of what would meet that next level of their career, their existing functions as described in the current position would be in line with the budgeted salary for the position. And should they attain a CDL and then become eligible for a heavy truck driver position, we would say that that is their professional growth of their next career path.
Okay. I got one more question. I just got to find it. Okay. Our entry-level positions are in the lower 50s, the entry-level positions. And I guess that's why you hate to put a lot of training into someone and lose them because we have them at this level and we're not really showing a progression where they could go into full-time. We're not giving them an incentive to stay with the department, to work on that CDL and get that full-time department. We kind of have like a entry-level person who's kind of picking up, they're doing the flagging and work like that. And there's this big gap. Is there a way to bridge that so we don't lose these people, so we don't pour a bunch of training into them and they go and find a better job once they get trained at Young Brothers or or mine service before they do get that Class A CDL?
We would probably want to go back to the job description
Okay,
itself and to see what expectations could be added as kind of a career ladder of this is now your next
okay,
training level, or this is the function that you're at now, or able to actually perform, and see if that warrants some sort of different position, and therefore another salary, or a different salary, or a different pay grade. Because I think currently now that position is a B4 pay grade. And so the salary is in line with the pay grade and the functions.
okay. Now, I don't want to speak for you, I'm kind of speaking for my crew member position.
I know you have one too.
Because he can amply speak for himself, but I would appreciate maybe visiting more on that.
Sure.
Okay.
The next department we have is the SO, but we've touched on, I think, these two already. And so after that, we have specialty courts. And so we have these listed as O's or others for the HR comment. And so there's a request to increase each of these specialty court positions. It's 3 case manager positions and then the director of specialty courts at or above $8,000 increase for each of the positions. They're currently at a 0.94 compensation ratio. I think we just need to, I say it's HR and with the help of the auditor's office, kind of go back and review the grant funding. So I was under the impression that these increases were going to be grant funded, but I think that the grant is still pending approval. So we kind of need to go back and
Okay, I thought this was grand.
better make my assessment.
Okay.
That's why it's an O right now.
Once we know some more definite information, we'll bring you some back.
So 4 of 96. It's the only one. I'll point that out. We can move on to new position request.
Can I ask something about that position change request? Can we, or I don't want to speak for anybody, get a spreadsheet that just shows the positions you either gave a Y to or a Y and an N to on a separate spreadsheet? Because if
Okay.
you gave it a no, I'm not gonna really, but I want to see those by themselves, and kind of see what was your methodology, especially on the ones that you gave a Y and an N to.
Okay.
Okay.
Yes, ma'am. So here, first up, we have the 74th District Court request for a new position. And we say new position, but of course, there's also the understanding that the department would be giving up its part-time fund, which I actually don't have that offhand. Do we know how much that is?
The 19,500.
19,000, okay. And so luckily Judge Coley has already spoken on his need for the position. He's taking on that administrative judge function. And it is the only civil court with only one full-time position. The others have 2. The next, no, that's on that, okay. The next adds to staff are under the district attorney, which we've kind of had that surface level review of with their whole org chart. And so HR has yeses under those for support or recommendation for each of the 6 positions, just based on that staffing data compared to other peer counties, where it appears like we're understaffed in our district attorney's office. We did question the district attorney on kind of the need for the 2 attorney positions and why they needed to be at a tier 3 versus a 2 or a 1. And they did explain that those 2 positions were going to be assigned to the juvenile division and the crimes against children divisions, which they say are more complex and harder to find experienced attorneys in. And so that was the reasoning behind having it as a tier 3. If there's no questions on that, we can move on to IT. We've covered as well. The 2 adds to staff there being the audio-visual technician, which was a need discussed last year, and then the senior project manager position, which is to bring forward the project management office vision and have that person or that position head up that project management office. Following that, we've, I think, already covered the sheriff's office, and that should be it, right? Okay.
Under miscellaneous.
Miss,
Or under miscellaneous.
under miscellaneous requests, we have here the district clerk is requesting salary supplements related to a specific fund that they have, but we don't have details on how supplements would be distributed and what amount and to what positions. So that has a no, because we don't have details. We have requested that from the district clerk, so. Should we receive information, we'll present that to you.
Justin's asked for it. Obviously, he didn't know the deadline to get the budget information in, so.
Following the district clerk, we have the elections department requesting adjustments to the hourly rates for their election workers. So $15 an hour for their election workers, and I think $17 per hour for the judges, election judges. And HR is in support of that. Just because countywide, we've tried to have all positions at least at a $15 an hour rate. So I feel like this would coincide with that. And then there's an existing $2 differential between the election worker and the judge. And so we would also agree with maintaining that differential if the election worker was raised to 15. And there is a struggle with the elections department to attract election workers for those days. The following request is from engineering. And so engineering, we've struggled to attract applicants for the existing assistant county engineer vacancy.
How long has that been?
I think 8 months, close to, or a little more of 8 months. We opened up the qualifications for that position without affecting the pay grade by making a engineer license not a requirement, and just having an engineering degree be a requirement with the expectation that you receive your license in a certain time frame. Following that change, we did see applicants come in, but there's still a preference to have them licensed, so they're not being considered for that reason. We did have a licensed engineer apply for the position that met the experience requirements of the position and had experience with roads specifically, and it was their experience was from TxDOT. We did recommend to the county engineer to consider the applicant. I do not believe they were. I wanted to give that context here, so because the premise behind this request for an engineering technician is to help with the workload that is left by having the assistant county engineer position vacant. So we have the engineering technician request and a part-time role at $30 an hour, which we help, come up with that recommendation based on market salary information. And if we're not going, if we are struggling to fill the assistant county engineer, this could be an alternative, is finding some sort of part-time technician to help with some of those functions that they're currently struggling to manage in that office. And then should that function well for the department, we can bring that back to the court as a possible full-time technician and see if that fulfills the need of the department. So there's an O there, just because HR would like to see the qualified applicant considered before doing this, but that happened months ago, and so they're probably not interested in the position anymore.
And we can schedule Zane and, of course, any other person from the department to come back in and speak to specific areas that may want to put more information around. Be glad to do that. That's generally the way we've been doing it, so.
I think Zane's gonna be here Friday anyhow, isn't
Yeah, yeah, that's a good point.
I think the concept could work of having that.
Well, I think with the amount of bridges that we
See the
have,
workload.
yeah, and, special projects and things like that, it would be good to have that person with that, at least some technical knowledge. Even if they're working with a third-party contractor, to at least know what the plans say and be sure it's being built according to plan.
So we have that. The following, I think the next ones are certificate pay, but then there's just one remaining for this miscellaneous tab, and that's the JP5 request for a part-time pay increase to increase the hourly rate. And we have that as a no for HR support. The current rate is in line with other clerks performing duties for JPs. So we wouldn't recommend an increase. And also, this position's already working, I think, the maximum hours a part-time person could work. So it's not like they could work more hours, and that would be a need for the increase.
Oh, there's a person in that position?
There is a person in that position. Another justification provided by the department, it wasn't listed on the request, but when talking with the official, they also mentioned that they wanted to submit this request because that person is performing a lot of bilingual or Spanish support. And currently, our bilingual program doesn't apply to part-time employees. It only applies to full-time employees, so there's not a way to provide compensation for that, but the department does have 2 other full-time bilingual speakers. So I just want to point that out to see if that was something the court wanted to consider in that request.
All right, so let's back up here. Un momento. A part-time employee who's doing bilingual work for us because they're there and they're doing it. We're not compensating them for that, but we are a full-time employee doing the same thing.
Right.
Something to look at.
See?
All right, that's something to look at.
All of our part-time people earn that $15 an hour. Is that what she's at 15?
Yes, ma'am. That's the current rate. So I think that takes care of all of
Judge Bain's here.
the requests.
I think Judge Bain wants to speak to that deal. Judge Bain, if you want to come up and.
Thank you. I've got a little handout I'd like to give you.
Oh, I know. That was pointed out.
I'm big into handouts and flannel board storage.
There's not much of a handout, but
Thank you.
Thank you, Judge.
okay. What I've requested is for the increase in Karina Vallejo's position, which is the pretrial services assistant coordinator. What I'm showing here on this handout is what the administrators are all paid, county courts, district courts, the indigent defense coordinator, and the pre-trial services coordinator, which would be Crystal. As you can see, they're all paid the same amount. On the assistant administrators,
they're all paid the same amount. Some of them have more than one assistant administrator. Until you get down to Karina's position, the pretrial services assistant coordinator, which is paid less. And from what I understand from HR, the assistant administrators are B7, and Karina's currently in a B5 position. I've never have really understood what the numbers mean, but apparently that makes a difference. Her work is very much similar to the district clerk's office, the county courts at law and the other administrator. She helps with my docket. She sits with me on hearings. She prepares orders. She prepares warrants. In fact, she has to know and be able to perform all the same functions that our pretrial services coordinator does, so she can carry on all those functions when she's gone, when she's on vacation, all that stuff. So she had to be trained on all that. We're also going to increase her responsibilities in that she needs to learn all the bail bond business of handling bail bondsmen and going through all those processes, because at this point, Crystal, the coordinator, is the only person that knows how to handle all that, how to do all that. So now that she's kind of got everything down on the rest of the work, we need to start training her to be able to handle all of that also for when Crystal is not available. I would dare say that, our office is a very busy office. We start early in the morning and we go all day. That Karina does more work than you would see a lot of the other assistant administrators in the court and all doing. I've been attempting to do this for quite some time. I ran out of time last year to present this with all the judges that we were trying to get together and all those sorts of things, and I just ran out of time to try to get her taken care of. So I'm wanting to do that this year. And I just think it's inherently unfair that she is not on the same level as all those other administrative assistants, including the assistant in the indigent defense. I don't understand why she should be paid less. And it's not much of an increase per pay period. I don't know if it's like $80 every 2 weeks, $40 a week maybe, but just that she be on the same level as everybody else there on that sheet.
Hannah, what's your?
Yes, sir. So the last assessment that HR completed related to the functions of the pretrial services assistant position was in October of last year. And just in Judge Bain speaking now, it sounds like there may be a difference between even then and now.
Yeah.
And so that hasn't been assessed, or any additional functions or duties. We've not completed an assessment on. And so we're working off of that October information that we received, which accounts for 40% of the functions being related to creating orders for mental health reports and distributing the reports to the courts. There is assisting the judge with arraignment hearings, but it's mostly compiling records and information prior to the hearing and then entering in inmate information into the PSRS.
Can you,
Now, we have a clerk now. She started yesterday, so we actually have a clerk in the pretrial services. I think even before the additional work that she's going to need to do to learn how to do the bail bond, I think she already fulfilled the requirements to be online with the other administrative assistants. I think if you actually do sit down and compare the functions of all those, you'll see there's very similar.
okay, so if you and Hannah would get together and then she can bring back, reevaluate the situation.
Okay.
Thank you.
Thank you, Judge.
Is she going to the jail to do the PRS?
No,
Okay,
not unless we have to.
okay,
We're able to do that on the computers from the office.
okay.
All right, Francis?
And sometimes the jails, for some reason, like this morning, they couldn't access it. And we've had to do some of that sometimes for the jail, but
Okay.
most of the time, the jail takes care of it. All right, thank you.
All right.
Anything else?
Go back to my things I wanted
While
to.
she's checking, I was gonna say, so I know that was a lot to digest today.
Yes, you're
Thank you,
excused.
But, you know, on a notated, her recommendation, yes or no, or there was some other, other notations. So we can sort those, and I didn't hear a lot of pushback on her recommendations. But, you know, and again, no decision has to be made, of course, now or even in the next week. But if you're good with her recommendation to be yes, we'll put those over in a category. We'll have the no's and the other categories, and then, we'll leave those as is, unless you want to revisit one of those.
Well, there are maybe one or two things to discuss, but I think generally speaking, yes, but also I'd communicate with the chief that there's maybe some of those things, if they want to discuss further, we can do it and then make final decisions in, but general consensus is that we move forward. There's also a couple others. One, we'll talk about it later, but it's a position that's currently at one of the courts. It could be moved somewhere else for its purpose, for its better utilization.
I don't have anything else. I'm just double checking my list. The only other thing, and I can address it at a later time because it sounds like I may need to come back to before the court anyway, and that's related to HR's actual budget.
Okay.
And there was comment or mention or question of that this past Thursday. And so I'm available for those questions whenever the court would like.
Well, you'll have to come back because it's neutral right now. There's no change in HR until you come back and tell us why we should.
Okay.
Okay?
So do we want to move on to sheriff's office?
Thank you. Well, thank you.
So what I think that, what I passed out is just a really high-level summary of their operating budgets last year compared to this year's request, and then also capital outlay last year compared to this year. David could speak of specifics, of course, but if you look at the top part, you'll see all of the, each department that falls under their umbrella, and you'll see there's an increase from year to year of $793,000. I want to point out that a little over $600,000 of that increase is related to the jail medical contract that was approved last Thursday. So that really is what is driving that increase. There, very
It's about
small increases in other places.
1.99% without it.
And the same with capital outlay, of course, different items that are listed, but a $43,000 increase from year to year. So very minor changes there when you look at the increased cost of items, and very understandable, but David's going to walk through those increases.
Do you want to go off your screen or, I'm sorry, Commissioner, go
No,
ahead.
you go ahead, because I want to
Do
get
you want to
the
go off your
first,
screen or off my screen share?
first shot in here.
How do I screen share? Because I'm just going off of y'all's document.
Wait on, get up, put it in there, because I want to get a,
0 and 20, numerically.
while you're putting that up,
Yes, sir.
as a starting point,
Yes.
current year budget, total number. What you're requesting, next year budget, total number, percentage-wise, what difference are we talking about, David?
About 2.6%, 2.7%.
Under 3%.
Yeah. And that's if you would give us everything operationally. Once again, the operational increases in the department may not be worth y'all's time. I know it's getting late, but I'd love to go over it with you. You're talking about a $100,000 increase So the total on our list is $790-something thousand, but $606,373 of that is specifically related to the medical contract. That also includes Bill Loeb Juvenile Justice Center, which is not going to be within our budget, but we don't have a way to split it out at this time. Sorry, I'm trying to talk fast, get through y'all's stuff as quickly as I can.
But
Respect
that
y'all's
was the
time.
number I wanted to hear. From
Yes.
This year's total budget, the requested total budget, under 3%.
Correct.
Okay.
It is. So just real quick, operationally, 0120, we're asking for some increases in the part-time line and also within the motor vehicle operation line. We have a very detailed report for the usage of our fuel based on our county, average usage, mile reports, lots of stuff to look at if y'all want to see that. It's pretty minor in this department. The part-time pay increase is specifically for the increase in salary for the HR assessed $15 an hour part-time wage. That position has been historically unfilled. It's now filled. We have enough money to get through this year just fine, but we're asking for that adjustment to allot for that part-time slot in the upcoming fiscal year. Stepping down to the repair and maintenance line. So cost of parts, cost of repairs, and just historically trying to fix the inaccuracies of how we pay for fleet maintenance. In the past, we have associated those costs to multiple departments, and we are now doing everything we can to allocate them directly to MOE so that we have a better understanding of what fleet maintenance is and what that cost is to the county. Sean Nixon has some extremely interesting reports on that. And then the radio tower, that's Frank Patterson, Ken Bass. It's beyond the purview of our control. They sign the contracts. We don't even see them half the time. So they're asking for that increase in that line. Moving on to 2200. All right, so we're asking for some additional money in our supplies line item. This is to replace some electronic hearing protection for handcuffs, medical kits, things that are just wear items for us that we need to replace. Nothing huge in that line. Motor vehicle operation for asking for some additional money in that. We'll send y'all the fuel report if y'all want to review that. Cellular and radio, we're asking for a couple of cell phones, one for an evidence technician, one for our front office clerks. Those ladies are often asked to send pictures of case information to detectives, and they're currently doing that on their personal cell phones, and we need to get them off their cell phones and onto county devices for official county business. Other services and charges, this is a request for, we're asking for some full Adobe licenses. This is like through us, through IT. We use that for making PDF packets, redaction for open records requests. We do, 4,000 to 5,000 open records requests per year. So it's not a small business for us. We're also asking for Cellbrite Gray Key. And I believe that the district attorney had a similar request, and we have made sure to request it in the same mannerism through coordination with the auditor. This is the other half of the district attorney's request for that Cellbrite and Gray Key. Professional development, we're going to increase that just ever so slightly, and that is to send some of our investigators to the Fire Investigation School. This is not arson investigation as a full-blown deal, but it certainly is helping them get up to industry standards for looking into these cases to determine what's accidental and what's not. Moving on to 2410. We're asking for a slight increase in our supplies, a slight increase in other services and charges, and this is for switching from log staff to Guard 1, but mainly it's just because of a historical shortage that's been identified in that line. So just to bring it to where we're not going to have to request additional money from the court to do a budget amendment. Professional development, we're asking for a small increase, and this is all part of the 6-year plan that we had to just gradually try to step up that professional development lines within our departments because our average expenditure per head was around $225. So it's getting better and better and better for us. And we're just trying to creep that up with as little impact to the overall budget year over year as we can. That's all within that department. 2411. We're asking for a slight increase in supplies. We're asking for a little bit more in equipment this year than we did last year, but that is due to specific requests. We're having to replace some kitchen items, also some furniture like desks that have completely disintegrated, and we just need to replace some of those desks for those guys because they are in very poor rapport. A slight increase in uniforms, slight increase in other charges, services and charges, and this is going to be for the contract switching from LogSoft to Guard One, and just that slight uptick once again in professional development to get past that $325 expenditure per head. 2414. There are no changes. Everything's going fairly well in our medical department. The only change is the medical contract, but y'all are very aware of that. That is our medical management line. That will exist in 2414 and 2415. The prices that you see in there are split at 80-20. We don't have the final numbers from the company. We haven't even been able to remove Bill Logue's service fee from that at this time. But we will, of course, update that as the process goes along through Ken Bass and negotiations with the company. 2415 is our JHDC medical department. Same exact thing. You'll see an increase in that one line for management services. And those are the two main problems that our medical departments have, are the requests that you will see addressed with changes to personnel for our RNs, and the issue that we have with the medical contract provider and having that new contractor set up through the transition, which we appreciate the court's consideration on trying to get that pushed through quickly for us so we can get those services up and running. Moving on from there, we'll go to 7920.
Can I stop you real quick?
Yes, ma'am.
there? So just to sum up, so he went through the six departments, the operating increases there. And again, like we said, right under $800,000 increases, but about $600,000 is related to those medical contracts. So anyway, just summing up.
Yeah, so when you see that 8-some odd percent increase for operations, if the medical contract had not existed, it's below 2%.
Right.
Between the departments for operations.
Good.
Moving over to capital, go ahead.
Oh, no, you go ahead.
Okay. So overall, our capital this year, okay, you put it in there.
It is, the sheet I passed out, there's a TASER program that David's gonna speak on as well. It's not listed in your capital list on your sheet, but it is included on the screen, so.
Yes. So the first part of this is going to be the Patrol Tahoes, K9, CID, and unmarked vehicles. That is our fleet request for this year. The increase that we have for our fleet request from last year, same number of vehicles, that's the agreement that we made with the court, is 3.44%. So that's a very tight increase for us to be able to squeeze it in at that, because last year was almost 18% over the previous years when the vehicle prices initially went up. Moving on from there, there's 3 copy machines that you'll see on here. They're all Konica Minolta. CTWP has identified 3 of our machines that they will no longer be able to offer us service contracts or maintenance agreements on in any fashion, which means no toners, no repairs, no nothing for them. And they have said by the end of this year that those 3 machines need to be replaced. They have recommended these Konica Minoltas. We don't personally care. They've always been, the supplier's always been good to us, made decent recommendations, and we just need to replace those 3 machines. The Elastic Drug Terminator. So this is for destruction of evidence. It could be items that contain bloodborne pathogens, or it could also be narcotics destruction. So the current areas that we utilized to do that were Navasota and DPS. Navasota is, of course, not a short drive, nor is it inexpensive if you look up the invoices that we've had to pay them for the per pound destruction of that evidence. What this allows us to do is have our own machine that we can then incinerate. There is one piece of that machine that is a consumable, and that is the drum, and that will probably need to be replaced yearly at a cost of around $1,100. DPS was our other option for that, and their machine has broke, and they have said they have no interest in repairing it, as insert reason why here. They're just not going to offer the service anymore at all. So having a solution where we don't have to send 2 personnel transporting drugs to Navasota, Texas to be destroyed is a bad system. And
A steel drum has to be replaced
it's
every
a
year?
stainless steel drum, and they said due to the heat, it can cause warping or the bottom to fall out. So that's a consumable part of it. And they said that on a yearly basis, it's not a bad idea to replace the drum, which doesn't sound unreasonable to me, because we plan on housing this out at our Boat Barn MOE area out there at the jail. We've already had the jail inspector approve that location and look into that we're not in any compliance issues, and the fire marshal as well to make sure we have appropriate fire extinguishers. We'd basically be ready and set up to go with something like that. Next, going down the list, we're asking for some night vision. This is the final year of the request for this that started off 3 years ago. Once we receive these units, we will hopefully not have to receive any more until after I'm retired. These have a 15 to 20-year shelf life, and we are very happy that y'all have been able to support us on this, because we had 0 capabilities prior to y'all agreeing to this 3-year process for us. Next on there is a BTI Ram Pry Door. This is a training tool that we plan on utilizing for training our guys how to breach doors, making sure that our SWAT team, and not just our SWAT team, are breach capable. We also have an SRO. It's a very important training, and we also provide training for Guardian programs at several ISDs. And one of the biggest skills to have in an emergency in a school where you have an active shooter is having someone that is breach capable, who can get through a locked or barricaded door. So that's simply a training tool. The Motorola radios, that is our standard ask for radios. We ask for 10 every year. 3 of them are encrypted, and because they are encrypted, they cost more money. With the price increases Motorola has doled out, last year we bought those same radios. They were not capital. This year the price increases, they are now capital. Interview room recording system. This is for our CID division, but really more than that. When we originally moved into that building, the 2 rooms were set up by Wayne Kennedy, and with surplus parts he had laying around, we got a VCR and a 144p camera, and that is our video recording system in our interview room. And it is outdated. We can't find parts at flea markets any longer for it, so it's time to get a real system. This is using the same company that did the audio-visual solution here in the courtroom. They were recommended by IT and TJ and building maintenance, so we just stick with what the county's used to. We're fine with that. We're asking for 1 additional drone, and that drone has been of great service for us, having a good thermal camera on it that are great for search and rescue. They're great for finding people who flee. They're great for finding support of any type of fire operation, wildfires and land fires, which we've been called out for. It's just a magnificent tool overall. I'm going to skip management. Let me skip that one. Yeah, so I will tell you right now that EDOC setup and integration of e-signature, we want to pull that request.
Okay.
Pull. Yes, sir. Konica Minolta, that's the rest of those copy machines I mentioned up above, the total of 3. The camera system for the DWI room. Our current system is the same as the one that we have in our interview room system. This is going to give us a DVR, and it's going to integrate it with this adaptive system already out there at the jail. It's $5,500. It's a very reasonable price for the camera system, the DVR, and the syncing up to the current systems network. The last one is the big one. That's our TASER program. We currently have 5 different TASER models that we maintain between our downtown sheriff's office and the jail. We have 5 different cartridges, 5 different batteries, and 3 different training programs that people have to go through depending on what model of TASER that they currently maintain, possess, or are issued. What this program will do is it will allow us to get all new TASERs for our downtown patrol office. That is 75 units. It includes the training, the cartridges, the battery, the certifications, the cartridges we need to certify people. It's the whole kit and caboodle, so to speak. But that is a perpetual fee for 5 years. If you agree to that rate, that rate will continue every year within capital outlay for 5 years. After those 5 years, those tasers are ours. They're really ours day one. After that occurs, we would come back to the court with a revised quote where you would see a price increase. You will not in the first 5 years, but after 5, and ask for a new program to get the jail tasers so that the patrol tasers go to the jail, the new ones go to patrol, and we never have to maintain more than 2 generations of tasers within our fleet of ESD weapons. So, any questions on that? I know that's a big,
How did we get the 5 different models of tasers?
because we have been à la carte forever, and it is getting too hard, impossible to manage.
Are you
It's very
trained
difficult.
on one particular type of taser, and then it's
So that-
possible to get another one?
So the way that the batteries work, insert, exert, turn on, turn
Yep,
off,
yep.
and then the actual cartridge, like, when you go from, okay, if you go from X26 and P26, those are single shot square box. I know you probably see them, Commissioner. And when you go to the Taser X2, now you have 2 slimline cartridges, and then now it's a double shot unit. And then you go to the Taser 7, and I believe it's multi-shot. And then the Taser 10, the new one that we just got, is a 10-shot cartridge. So it's a proprietary technology that company has,
They got the corner.
they
yeah.
have a monopoly.
Yeah.
That's what it comes down to. They have a monopoly on
Would you
it.
have to be trained each time you change the type of taser you're using?
I don't have the answer for that, but I can get it for you. I know they have to certify yearly as it
Right.
is. Yes.
That'd just be impossible.
Because we're paying for all those cartridges currently just
Yeah.
$28 to $34 a pop, just depending on which model it goes with down the line.
Okay.
And from a training standpoint, it does cause problems.
Training's
But just
not-
from a,
Simplify life tremendously. You ought to,
yeah, just the logistics of trying to manage 5 different models of something
Right.
amongst our employees is
keep
very, very
supplies.
So that is it for capital outlay. If you have no additional questions, like I said, this is approximately 10% or 8% increase on our capital outlay overall. Moving on, personnel.
Yes, sir.
Do y'all wanna touch on the management systems at all?
Pardon me, do we want to what?
Did y'all wanna touch on the management systems at all?
That's going to
or-
be a long deal.
Okay, well, we'll just leave that there as a placeholder.
But I will do it if the court has
That's-
time. I'm
I just
assuming
wanted
they
to
want to
make
get going. So the management system, basically, we're looking for an RMS and a JMS.
Right.
And that's the question mark or the elephant in the room, because that number could range from mild to wild.
Yeah.
We have a pretty good idea of what that number is going to be and some help with the court, possible solutions and helping pay for it. But it is not something that we want. It's got to happen. There's no ands, ifs, or buts.
Right.
And you can talk to our IT director about it. We're,
I have, and it might be good to maybe have a schedule, you and the IT director to go specific on that so we can spend enough time on it. Because it has a lot of consequences, but, you know,
Could that be part
Absolutely.
of IT tomorrow afternoon and have David here when
We'd be
IT
more than
touches-
happy to.
touches on it? Is that possible, John?
Yeah, certainly possible. Fine.
Would that work, Judge?
yeah. Okay.
Personnel, do y'all mind if I hit a couple of things on the personnel tab real quick?
Okay.
That HR went through. The only things that we wanted to hit were the 2 items. I'm just going to,
For what position?
let's see, personnel and special ops. They're both SO. Oh my, I was trying to see what filter you're pulling
How do
down.
you spell that?
Oh.
Okay, so these 2 positions, the top one is going to be our personnel corporal, and on that particular position, the comment that Anna made was that there are 6 supervisors in the personnel division. There is a huge asterisk beside that. Inside of the personnel and training division, which are two separate divisions that report to a single supervisor. They are independent divisions. In fact, in about 3 months, they will not even be housed in the same building. So personnel does not have 6 supervisors. Personnel and training as a cohesive unit, like your office workers and your yard guys, if they reported to a single supervisor, they're very different duties, and these people have very different duties than the people in the training division do. So those person reporting to the same supervisor, I don't want that to be conflated as they are the same thing or do the same job. Because I report to the major, and so does Captain Evans, and he runs a jail facility. I do a very different job than that. That doesn't mean I'm part of his facility. So I just want to make that distinction between having those two divisions report to a single supervisor does not mean that they have similar job duties necessarily. That is definitely a position that we are very interested in supporting, getting support from the court. We have there is not one supervisor that works in the personnel division that is not assigned to personnel that can help the person who is administering both of those programs, training and personnel. So in training, you have a long list of supervisors that deal with the physical training at the jail, the actual training at the downtown sheriff's office. They provide for over 400 employees professional training every single year, tens of thousands of hours. They have zero time to come and help supervise the backgrounds, the applications, the background investigations, keeping up with the new hires, making sure they're turning in the paperwork, letting them know what stage they're in the process at, everything that our background and personnel people actually do. And what this relief, or gives us in the form of relief, is the lieutenant who is over training and personnel currently has to fill out all paperwork for TCOL because they require a supervisor's approval on all the L1, L2, C1s, L3s, F5s, that paperwork that comes in for TCOL officially. And he told me, I don't need a sergeant, I don't need anything. I need a lowest level supervisor TCOL will let me get by with that can authorize these documents to take some of this rudimentary work off of my plate so that I can manage these programs. Moving on from that one.
Can you get back with Anna on that then, and y'all discuss those job descriptions, how they're broken out, so we're gonna look at that again?
Certainly. I mean, we'll provide whatever information. She had requested information from us about why the training corporal couldn't handle it. We gave her a 2-page long list of duties that guy's currently engaged in. We assumed we were in a better position with him on that position than what was actually set up here. So we don't have any problem getting back with him to sort that. None whatsoever. The last one is the special ops position for Captain Nixon. Captain Nixon is actually here today, and that position was presented to y'all just a few minutes ago as a pilot. And although it is a pilot, it is actually special operations. So Sean Nixon currently operates the aviation, the bomb unit, MOE, the boats, and the drones. And the problem with that is he is one person and he just needs help. So it just so happens that we have a commercially licensed pilot that is willing to do a job like this for us. So if the...
This is a new position that y'all were requesting for this, not the one to corporal, right? Just making sure.
Correct, it
Okay.
is,
Okay.
yeah, it's
So
from
we're
the new
following.
list.
This one?
It's-
That it
We
would-
currently have somebody in the SO who's capable of doing this job.
Correct.
But then you would fill that position,
And
although
although-
we need to fill back that other position.
Correct. Although they are saying, you will see a list of positions on here that says new positions, but there is not a single position that we are asking for that we are not giving up another position or a financial stake in another line item somewhere. There is no flat ask on our budget anywhere. This position in particular will really help relieve Sean for some of these special operations, get him some relief around the shop to where he's not the only person that gets called out every single week for all of these events.
24/7, 365.
Yes.
He's it.
And he has a long list of how many times he gets called out. and for what type of operations he's getting called out for, whether it's the water, whether it's the air, whether it's the drone, whatever it may be. And he just needs some assistance, and we are looking to get that base level deputy. We're not asking for some crazy deal. And then what we are going to do is evaluate what it is to have another commercially licensed pilot. And then if there's a stipend, like a K-9 stipend that they can attach to it in the following years, we need this first year for evaluation of how much aid they're actually going to be able to provide to Sean. Because as it works right now, Michael Graham engages in a lot of assistance with Captain Nixon, and he is your MOE manager. So every time he engages in these things to help Sean, it is detracting from what he's able to achieve at MOE for y'all, as y'all's department head over there. So we're just trying to staff that with a reasonable slot, base deputy. We're not there yet to where we can start talking about commercially licensed pilots and stipends. We just need time and service to figure that out.
Okay, I have a question.
Yes, ma'am.
Because the requested salary is this 56,000 figure.
Yes, ma'am.
The total request is for 21,998, giving back the 47,281.
That's equipment. So there's certain
Oh, that's okay.
basic equipment. There are some one-time costs associated. If you look down column H right there on the screen that Haley has brought up, there's radio. That includes like uniforms, gun belt, bulletproof vest, just standard loadout that we have for our deputy LE staff.
Okay, so I want to make sure I understand.
Sure.
The line. Evidently, the person, there's a warm body in here that's earning the 47,281.
No. So what this actually is we are asking to take a jailer slot that is vacant and vaporize it so we can give Sean legitimate help.
Okay, and then bring in somebody.
Correct. At the base deputy level.
At the net change to the budget.
Yes.
Is that 21,998?
Yes.
Okay. Okay.
Any additional questions?
I don't have a question, but I do have a comment. We have a number of people in SO who wear so many hats that we need to appreciate the fact that they do that. And there's really no compensation possible for what they do, but we need to do what we can. Secondly, training is one of those areas. And you're right, there's thousands of hours of training that go in that are required on those training cycles. We have so much of it that's done in-house. If we had to pay someone to come in and do all that, or send people out to do all that, that training budget would explode.
48,000 man hours worth of training last fiscal year.
So my comment is, any opportunities we have to send people to the training sessions, which allow those people then to come back and train our people, those are advantageous to us, time-wise, monetary-wise, and everything like that. So
Professional staff development has always been a high priority for the sheriff's office, and there will be a time where a discussion will come in where you will see requests for training, but they will also be, especially within our jail division, have a request for overtime as well. We have to start associating the personnel costs with the training. If you want the professional services, there's going to be personnel costs assigned to that at some point. We just
I like getting our people certified to be trainers.
we have quite a few of those, quite a few in fact. And I want to bring up one more quick thing for the court in regards to personnel. This is not directly related to the budget, but in the next full court session, we have a grant to join the auto theft task force for this region. And they have essentially came in and told us that they are willing to pay 100% of everything for this employee for year one, and that the county will have to pick up in year two the fringe only. So they're buying equipment, they're buying.
Pick up the what?
The fringe only.
Okay.
Just the fringe. So you get a locally based task force operator for auto theft, which is a huge problem in most counties.
Didn't we used to have a task force here that was an auto theft task
We
force?
do. We just
We
don't
still do.
participate. We don't participate.
We don't participate, I mean, I know
Correct.
DPS is part of it. and
Yes.
They did training on it.
Yeah, it's run out of Burnett County.
Okay.
It's a large multi-jurisdictional task force. So y'all will see a request come in just for consideration or approval of that grant. The way the state, it's funded by the MDCPI, so that fee that is charged on insurances, so it's not like other grants, because I'm not a real big fan of putting people on salaries on grants, but this is a statutory required fee that's on everybody's insurance. Everybody that has an insurance policy in the state of Texas has to pay this fee. So it's not going anywhere.
I
And
got
we'll-
one last, okay.
Yes, ma'am.
I got one last question. On your jailer transport
Yes, ma'am.
request, are there currently warm bodies in that slot?
There are warm bodies, they are deputies, they are already certified as deputies, and they are already engaging in those deputy required duties, yes, ma'am.
Okay, so we're not creating a position as much as we're just
That is correct,
increasing it by the 94.99?
correct.
Okay,
Their slots in the jail will vaporize, and whether the auditor, HR, they work that out about where they want them to be and what department is it new, is it a change. The slots there we're currently in will go away, and the new slot will be the funded slot with an additional $9,000.
okay, but they're not position changes, they're new positions?
I think that's how HR would probably better look at it, because it is a completely different type, classification, all of those things. So we would see it as a new position.
Okay, okay,
With a new number, new position number,
okay.
And that's because is it TICL that requires those transports to be deputy?
So
I
no,
know there's some
and I can
requirement.
expand on that just very quickly. I know it's getting late. But those positions in particular are not, transportation's bad terminology, it's fugitive extradition. It's warrant service.
Right.
That's what it is.
Yeah.
So these are the guys that are going and making warrant service in other jurisdictions in New York and Anchorage, Alaska.
And they have to be certified peace
Got to be certified to serve a warrant in the state of Texas or serve a governor's warrant, and you got to be certified to fly while armed. And technically with the IAD, you should be a certified peace officer to cross the state line into a bordering jurisdiction, especially to make warrant
And that's
service.
what this, yeah. okay.
Correct.
I
That's
knew
what
there was
these guys
some-
do.
I knew there was some
Yes, sir.
qualification or requirement they had to be
Yes, sir.
certified peace officer. Okay.
And that's pretty much it.
Thank you for being so patient.
Thank y'all very much. Sorry I talked so fast, trying to get y'all out of here on time.
That was-
Okay. So,
Don't y'all go though, don't go. Okay, don't go. Okay, go ahead, Francis.
so I mean, like I said, we've gone through a lot today, so I think, you've now gotten a glimpse of what all the requests are personnel-wise, as well as the sheriff's office request. And so I think now we'll kind of pull that together, and we can sort it now by what HR is recommending, not recommending, and then kind of sort through it that way. And you can, let us know if you agree with all of her recommendations and want to go forward with that. And the same with the sheriff's office, we'll kind of revisit that, step back and look at the total increase and whether you're okay with that based on his explanation. If you're not, we can work with them and see if there's any changes that you would like them to make. So,
And I think where it's just simple clarifications, we can get Captain Eyes on the phone or whoever we need to talk to or other department people.
definitely.
Otherwise, if it's more in depth, we can ask them to come in and try to make it as convenient and easy as we can on everybody.
Okay.
Would be the plan.
So I think we're set to join again. Is it 1:30 tomorrow? I think
1:30.
on the
1:30,
schedule I had
yes.
1 o'clock, but we posted for 1:30. So at 1:30, we'll have the information technology director with us again. And so he'll be talking through his budget and requests for next year. And then again, kind of maybe come back to some of these items we went through today and just look at them big picture wise. I want to circle back to our summary and just see how all of these things fit in and what that looks like as far as ending fund balance and then what tax rate would help fund those requests. So,
Okay,
Okay.
all right. Dustin, did you have something?
Yes, sir. I think Road and Bridge Precinct 2 has something they would like to share with the court.
Yes. I want to thank Tracy for being, she's just thoughtful, beyond thoughtful. And Anna didn't tell anyone, when you get my age, you probably hide your birthdays, but Anna didn't tell anyone it was her birthday. And so we just want to sing happy birthday to Anna. And we want Tracy to bring the cake forward, and all of us are going to have a birthday party for Anna.
And I want to say, I want to hear some.
Yes.
Plenty of voices over here on this side of the.
We'll do it, make no mistake.
Okay. Happy birthday to you. Happy birthday to you. Happy birthday, dear Anna. Happy birthday to you. We're good. We can almost give
Recording
competition to
stopped.
that Navy choir. Yeah.